Spilling the tea with Sandy.
K-Man's top news headlines of the day from CMR.
Good morning, Sandy.
Hey, good morning, Blake and Aaron.
There we are. There we are.
We're back on track. Look at that.
You're back in the circle of trust.
Oh, yes. Good morning. Good morning.
Hello.
How you doing?
All good.
All right. What's up?
So the, I guess, reverence and respect for the late Her Majesty Queen Elizabeth continues in the Cayman Islands. Yesterday afternoon, they had a special sitting of Parliament for the parliamentarians to be able to share their thoughts and comments on the passage of the late Her Majesty. And so that process took a number of hours as they did so. And it was quite interesting to hear a lot of them speak of their fond memories of the Queen and her various visits to the Cayman Islands. Some would have been more involved than others. So, for example, Mr. McKeever Bush was actually a prominent member of Parliament at her last visit. And so he talked about that quite a bit. But most people had nothing but really positive things to say.
Good.
Very well. I was just remembering, too, we in our lifetime, we can say that we were around when King Charles visited the island. I have video of when he and Camilla, was it 2019? I think they were here. They landed.
Right. Absolutely.
Yeah.
I have. We were all at the airport watching the big Royal Air Force plane with them on board land. I found that video over the weekend. So
That's cool.
Yeah, pretty cool. Always part of history in the making, to be honest. Oh my goodness. So sometimes we don't recognize that we're part of history in the making, but there you have it. So I know that we spoke a little bit about the fuel tank situation. The illegal garage situation in Prospect. And, we did receive some additional word that not only did Ofreg confiscate all of those gallons of fuel, but it has actually been shipped, or it's going to be shipped overseas, because the fire service had to spray it in order to contain the situation. They had to spray it with like a protective coating. And so the tanks themselves are actually of no use to anyone. So they will be sending those. I don't know where we send all of our stuff, but they will be.
So who pays for that?
I'm sure us, we the people, without a doubt.
Wow.
So this individual, we did speak with them briefly on the show yesterday, and he claims that he was busy driving his truck. So we are supposed to call him back with a view to hopefully getting some answers from the property owner and the business owner to see what on earth was he thinking. So we're going to try to chase that situation up.
It's dangerous.
I think if you have something illegal and you're not following the law,
you should pay for that, right?
Materials, you should pay for, getting rid of it.
Well, not only that, it was a residential area. What happens if it blew up more and killed you?
Listen, we don't even, honestly, you have no idea how real of a possibility that was. It's pretty scary.
Yeah.
Yeah. So, yes, indeed. But anyway,
and that guy, I don't know how close did he live to you?
Well, I'm in Lower Valley, so Prospect isn't that close, but still, we've got friends and family who are literally right in that area.
Yeah.
So it's not.
Those houses are all pretty close together. It's not.
Yeah.
It's
not it would not have been a good situation at all.
No.
So the good news is,
you never know.
Yeah. No, the good news is the authorities have really stepped up to the plate in terms of recognizing the predicament that this would have left the entire community in, and loss of life, and especially your fire service workers and so on. So I understand that they're taking some very, very serious steps for enforcement to step up to the plate a bit more and ensure that this type of thing does not happen again, because residents were complaining about him for a really long time. Wow. He even had electrical wires siphoning electricity from one location to the next, and had electrical wires. I think CUC needs to go out there and pay a visit as well. But yes, the neighbors also complained about that, and absolutely nothing was done. So pretty crazy.
Guys like MacGyver.
Yeah. Well, yes.
Not the
not the kind that we're looking for, but yeah.
Yeah.
So in Nigeria, I don't know if you've heard this story or not, but Nigerian authorities confiscated
Careful with this story. I know what you're going to say.
What's confiscated?
Nigerian authorities confiscated some 16 sacks of genitals from donkeys. So, it's as nice as I could say this on this family-friendly program.
I know it's
7,000 pieces.
This morning.
Yeah, I know it's funny, but it's not. What they do is they were using them. They send them over to like Asia somewhere, and they use.
So these 7,000. These 7,000 donkey parts were headed to Hong Kong, actually, because in the Asian culture, I guess they use them for medicinal purposes, and they probably think it makes them stronger.
There's all sorts of things that they use. This is the reason why, the rhinos are going extinct because of the horns, which again, it's just keratin.
Exactly.
Pull off your fingernails and eat your fingernails, and it's the same thing as a rhino horn.
It's crazy.
But they kill these animals, like they basically take off the parts that they need.
But are they
while they're
using
still alive.
donkeys like they're like cows, or they're just using all the parts? I mean,
no, the only part they need is apparently the donkey skin and the donkey genitals.
No, it's not nice.
And so Nigeria has said that their donkeys are actually becoming extinct because it's not like a donkey has, can produce 50 donkeys at one time. So they're like, listen. So legislators have been trying to place a ban since 2021. I don't know why they haven't passed a law yet, but they wanted to further curtail the export of donkey skin and genitals to countries like China and Hong Kong and so on, which again is used.
What does it do? Does it? I mean, like if it cures cancer,
it doesn't do anything.
It doesn't. Listen, it's all wives' tales. Like, it'll make you a better lover if you.
It's not
sip
funny.
a tea of donkey genitals or whatever.
I'm just saying, if it cures cancer,
it doesn't.
I'm going to be having
cancer.
some donkey genitals for dinner.
It doesn't cure cancer.
No, but there's some cultures that still hold on to these antiquated beliefs, and so they're making the donkeys go extinct. Poor things. So the estimated value of this particular shipment was almost $500,000 US.
Wow.
Yeah.
Well, and that's why they keep doing that, because they're like, I don't
money.
But whatever, I'm going to make this money. That's why they jump into the bush and they go and chainsaw. Never mind.
It's all about the money. But on that note, I got to skedaddle.
Yeah.
Restaurant month is back in October, by the way.
Mm-hmm.
Time for me to run.
Ah, cool.
Okay.
Yeah.
I like being on Bobo. You can click on while we're still talking.
Well, now you are. Good morning, everyone.
Good morning.
Hey, good morning.
We've got Blake and Aaron on Bobo this morning.
I like not having to rush. That's
well, all right. Let's take a few more minutes then. Government schools have received some conflict resolution training, and I'm sure a lot of parents are welcoming this. As we know, some government schools have a reputation for having to deal with a lot of conflict, even accusations of fight clubs that have been posted on social media. So these teachers have now, and administrators have now undergone a training segment. They include people from the Ministry of Education, the Department of Education Services, and various government schools. They've gone through the Team Teach program out of the UK to be certified as Team Teach intermediate trainers. So they will be able to train other people after this intense 5-day training course. So this is good news. And hopefully it leads to some real world differences, because already the school year has just begun. And I've had parents reaching out to me saying, hey, the situation that presented itself last year and the year before with their child still continues to be a problem. And so they are ever so concerned about, what they're going to do, because administrators, the police, nobody seems to have a real solution about how to deal with bullies in schools. So it's an unfortunate situation. I'm hoping that this conflict resolution training will assist in some positive way. Big shout out to MP Sabrina Turner from the beautiful district of Prospect. She has partnered with Health City to offer free cancer training for Prospect residents. So at her meeting and last week, Thursday evening, she discussed the necessity to, although some people might not have the financial means, to still offer them some basic, access to screening, health screening, and so on in the community. So it makes sense because she's also the Minister of Health. But more importantly, she has, brokered this partnership with herself and Health City, Cayman Islands, to bring these services specifically to her constituency. And she did say that it's important to, always think about preventative care. And just because someone doesn't have the financial means to go to a doctor doesn't mean that partnerships like this can't be, worked out. So congrats to both Health City Cayman Islands and Sabrina Turner.
Good. That's good.
Excellent.
Yeah, it's great. And she did eye screen, like when she, when she did her back to school drive, she did eye screening as well for the kids. And so some of the kids realize, their parents realized that they needed glasses and other things. So yeah, these types of preventative and screening programs are absolutely wonderful.
Yeah, we've had her on the show a couple of times, and she promoted the eye exam.
Yeah,
last time she joined us in studio. So,
and CTO has kicked off yesterday.
What has
Caribbean Tourism Organization Conference? Yeah, kicked off yesterday. I attended quite a bit of the afternoon events, which was just a lot of the Caribbean countries presenting their plans for re-emerging out of COVID. There's a lot of countries that rely on tourism far more than we do. And so their tourism product is extremely important to them. And they were talking about what the plans are for the future and, what new initiatives, new hotels are coming online. Some are doing infrastructure improvements. So a couple have like airlines or airports that are going to either be rebuilt or built. And some are building cruise port facilities as well. So all very interesting.
Yeah, I've noticed that just just around, it seems like COVID is, I know there's no regulations, but people have just gone about getting back to normal.
Yeah, I mean, we had two more recent deaths that were announced, and people were kind of like, okay, people will continue. Yeah, I mean, people will continue. To die from COVID. And I think people just need to be smart. You have the vaccine that's available. You have other treatment options that are also available to you. So, what you have to do is avail yourself of those things for sure.
Just like last night, I was watching with my wife. We were watching Wheel of Fortune. And I noticed Pat Sajak was like standing next to contestants and shaking their hands again.
Oh,
yeah.
I was like, wait. The Wheel of Fortune COVID regulations are gone. I don't know. Do you remember you used to watch and you would stand like 10 feet from the
right?
I haven't seen that's.
Really?
Yeah, I figured that would be it though. Huh? Okay.
Yeah, he's back to hugging contestants. And
Jeopardy was always Alex Trebek was always away.
Yeah. That stays the same. Anyway.
Yeah, no, people are definitely feeling a bit more comfortable, and I've had a couple of friends who are now just getting COVID for the first time, and some of them have said it's the worst they've ever been sick, but they are vaccinated. And so, they've got a bit of a fighting chance and they're making it through. And I have yet to knock on something. I've yet to get it. So I'm like, hurry up, modified vaccine number 4. I need a booster shot.
Yeah. You and me, Sandy, we belong to a very small club.
Yeah. Yes. Oh my goodness. It's crazy. Some people think that means that you're immune to it. And I'm like, no. I'm not taking any chances. I'm just waiting for that additional booster.
Well, hey, I go back to something I read a long time ago. It's like if you drink white wine, a significant amount of that.
What is that?
That apparently that's
your secret. You're sticking to it.
I got it. And let's put it there.
Are you drinking white wine?
Obviously.
Maybe it's Chardonnay specifically. I can't remember.
No, I don't drink wine at all, so I don't quite think that's it, Blake. But that's good theory.
Well, maybe you're doing something different.
Not getting coughed in your face. That's a good start, I would say.
All right, catch Sandy's show right now on Bobo 89.1 FM. And we'll continue our show on KISS. We'll see you tomorrow morning for the Wednesday headlines. Have a good one.
Awesome. Have a good day.
Peppermint, sorrel, ginger, beaver grass, or English. Get it ready. Your morning tea just got hotter.
Ooh, honey child.
On the cold, hard truth. Bobo 89.1 and Cayman's #1 talk show are bringing you morning talk like no one else. Monday Rewind, Impact Wednesdays, Caribbean.
Oh, my apologies for the abrupt ending to that. But good morning, everyone. So yes, that was Blake and Aaron over from 106. As you guys can see, they enjoy being over here visiting us on, let me just grab some of my links real quick. They enjoy visiting us over here on Bobo 89.1 FM. So you guys know the deal. Today is what day? Tuesday. And Tuesday means that it is Medical Rundown with Health City. They kick off the program We've got quite a show for you today. I see, based on the comments, a lot of you found that donkey story quite interesting. It's actually quite sad. We'll talk a little bit about that, time permitting, a bit later on in the program. We got to talk about sustainability. And of course, sustainability means actually protecting, our animals. Like, we can't make donkeys go extinct. My God, that'd be horrible. So we'll talk a bit about that. We do have the governor who's joining us right around 8:30 as well this morning. So we've got a full program for you. Get your questions ready, 936-2626. And we've got some really, really interesting guests from Health City this morning. So let's go ahead and take an opportunity now to introduce them. So first up, we have, let's go ahead and pull Ben Mead into the program. This is actually Ben's first time, as far as I can recall. Yes, Ben? On the
morning, Sandra. Yes, indeed. My first time with you in this format. How are you doing?
Yes, we're doing fantastic. Ben is the marketing and communications manager over at Health City. He's responsible for the coordination of marketing and communication related activities for the services that are offered at Health City. So he serves in a key role to support the chief business officer and head of sales and marketing, which you guys will know, Mr. Shamari Scott has been in the program a number of times. So Ben, warm, cold, hard truth. Welcome to you this morning.
Good morning to you, Sandy. Pleasure to be here. Big shoes to fill this morning. I'm not sure if I'm as suave as Shamari is, but I will do my best to ensure that you and the listeners have all the information they need this morning.
Absolutely. Fantastic. So, yes, and I always tell people on this program, we do not bite. It's pretty easy and straightforward. And, our audience always enjoys having you guys on, and we missed you during the summer break. We also have joining us this week, Dr. Gupta. I hope I've gotten that name correct. Dr. Gupta is, really, if you have, as you get older, Dr. Gupta is the one that you might want to see. So he is a consultant in general and geriatric medicine at Health City. He's worked as a substantive consultant physician for over 18 years in general medicine and medicine for older people at a 600-bed facility in Peterborough, United Kingdom. So, of course, he has extensive experience and comprehensive assessments of patients with neurological, musculoskeletal, and chronic illnesses. He provides what Health City says is a holistic management approach, working closely with both your physiotherapists, occupational therapists, social workers, and others, really aimed at, as you get into your senior years, maintaining your independence, reducing any frailty that you may have, and managing adult patients in their own surroundings, hopefully, prolonging any hospital or prolonging the need, or avoiding, I should say, the need for any prolonged hospital stay. So, Dr. Gupta, good morning and welcome to our program today.
Good morning, and thank you for having me.
Yes, well, we have a lot to talk to you about. So we are super excited. I always say to people, sometimes I've got, friends and they'll say, oh man, I'm getting old. And I said, oh, what a privilege. It really is a privilege to be able to age. But of course, with aging comes a lot of aches and pains and lots of other things that we'll be getting into this morning. But really, it's trying to age as well as you possibly can. So tell us a little bit about what your overall, remit is at Health City and how you view the aging process.
So I'm a general physician, so I see all patients who are aged 18 and above. But my special interest is in medicine for older people. And what I want to really do here is to promote medicine for older people. So a lot of people are not aware of these specialisms. So people do not know that there is a specialist in medicine older people. They often think, they just have to see whoever they need to see because of a specific complaint. So just by way of an example, I'll tell you, say if a patient comes in and sees me for a cough or shortness of breath, and during the evaluation, they say, okay, I have a little bit of pain in the back. I find it difficult to walk. I also have problems remembering stuff. I also have problems, getting up frequently in the night to go to the toilet. So there are a multitude of symptoms. And that's often common in older people. And what we are trained is to do what we call a comprehensive assessment. So it's like a head-to-toe assessment. And we are trained to examine all the systems in a thorough way and trying to come up with a diagnosis to help them. And it's basically a diagnostic process. And one of the crucial steps in those diagnostic processes is to evaluate what medicines patients are already taking, find out if some of those medicines are causing some of the symptoms. We call it a medication review, taking them off the medication, bringing them back and evaluating again before making a diagnosis. So you get what we call a comprehensive assessment, and that prevents the need to go and see several doctors for each complaint. What it does not mean is that, when you need a specialist, say, for example, during the evaluation, I find that your spine is really narrowed and you need to see a spine surgeon, I will take the help of the spine surgeon to try and help you get better. But, what I want to do is give you a full evaluation so that, we can come to a diagnosis and help you manage those symptoms. 1 in 6 adults will have more than one illness. So often we have older patients having several illnesses, taking several tablets. And sometimes, you wonder whether these medications are working against each other and causing some of the symptoms. So that again is something that we go through in the clinic and work with partnership with the patients to try and get them better.
Yes. Well, I can tell you, I'm kind of at that middle age, 40 plus, and there are definitely some things that, you do notice, even the necessity to get a little bit more sleep than perhaps you were able to skip in your 20s and 30s. Your body is going through a period of adjustment, and I think both men and women probably, have very specific things to the sexes, but, the joints are not quite what they used to be as well. So there's lots of things that we need to be aware of and cognizant of. And I think the quicker that we address any potential issues and see someone like yourself, obviously the better off that we will be. So we do have an event that's coming up this month. World Alzheimer's Day is going to be September the 21st, so right around the corner. And this is one of those things that, I think as you get older, you kind of become concerned about your memory. Does everybody have some degree of memory loss as they get older? Or some people just remain sharp as a tack right up until?
Yeah, I mean, it's often difficult to understand whether the memory is due to you getting old or whether there is actually something going on. So we can be forgetful from time to time, but that forgetfulness, if it happens almost on a daily basis and starts interfering with your life, then that's definitely abnormal. So there are several signs of aging, several symptoms of aging, which we associate with aging. And, you may be right that they are because as you're getting older, but we have several means of finding out whether the symptoms that you are experiencing are due to you getting old or whether there is actually an underlying process that's going on, such as dementia, that's affecting you. So what we usually say is if you start noticing that you're having difficulties with your day-to-day life, then it's definitely something that you need to want to check out.
Right. So can we get sort of a baseline definition of what Alzheimer's is?
So Alzheimer's is a type of dementia, and dementia affects memory loss. So there are kind of 4 pillars to memory. One is obviously remembering memory. The other thing is thinking and reasoning. So your ability to think rationally, making reasonable decisions that can get affected with memory, and it can also affect mood. So those are the 4 pillars to making a diagnosis with dementia. Usually with dementia, you find that these problems are not kind of one-off. You experience these symptoms almost on a daily basis or more frequently than daily basis, not occasionally. So when you start having symptoms like that, it's probably best to get to see a specialist so that they can make a diagnosis. It is a complicated diagnosis, so it requires a full evaluation of the symptoms, evaluation of memory, examination, and doing some tests to come to a diagnosis. But once we make a diagnosis, we can definitely offer treatments that will definitely help improve and hopefully prolong your ability to carry on independently. So one of the things that people with dementia are scared of the diagnosis is that they know that it might result in them losing their independence. So they have to rely on others, and that can be a scary prospect. But it does not necessarily mean that will happen to you. But if you can get an evaluation, then it'll be helpful. There are other things that can present as memory loss, so like hypothyroidism, underactive thyroid, vitamin deficiencies, some electrolyte deficiencies like calcium deficiency or high calcium levels. So those things we can reverse. So we have to do some basic tests, find out if these are causing some of the symptoms. Sometimes even medication can affect memory, and taking you off the medication and evaluating will be really helpful. So there is, it is important to get it evaluated.
Yes. So this isn't something that you should be trying to assess yourself, because there is a difference between Alzheimer's and dementia, and it's important. Are there different treatment options available then for each of those?
Yeah, there are lots of very different treatment options,
Yes.
Sandy, and this is why we have Dr. Gupta with us today, right?
Yes.
Because we think, okay, I'm just getting old, I need to do X, I need to do Y, and not be stubborn and not go to the hospital. But as we talk to Dr. Gupta here, we realize that there are various specific treatments, some only available at Health City on Island, and that you can get properly assessed and get the proper care. Dr. Gupta?
Yeah. So the basic treatment for dementia is replacing, helping a chemical called acetylcholine in the brain. So this is a neurochemical which helps connect the neurons in the brain to make connections. So in dementia, we tend to have less of this chemical. So we have medicines that can enhance the acetylcholine in the brain. These are called cholinesterase inhibitors. And probably you may have heard the commonest one is called Aricept or donepezil. It's available as a tablet form. It helps improve memory, but it also helps what we call behavioral symptoms. So you might understand it. If you have memory loss, you are finding it difficult to carry on with your day-to-day activities. So you find that you're having to repeat the same question again and again, and people are telling you what they've told you, and that can be a bit frustrating. Sometimes, the memory can affect your brain in a peculiar way. It can make you think abnormally. So you might imagine seeing things that are not there. We call them hallucinations, and they are so real to you, you tend to act out on them. So you might end up shushing them away, or you might tell them to go away. So these are kind of tricks that you can experience. And some patients then also have what we call intact long-term memory. So they have memory of their childhood intact. So they can go back in their lives and live as if it's real. So they might ask for mom and dad, although they are very old themselves, or they might suddenly, get up and do something very unusual. So they might imagine that they are in their childhood home and imagine that their toilet is somewhere where the wardrobe is now, and then go and relieve themselves in the wardrobe, not realizing that they are in a different house. So these kind of tricks can happen in dementia, and these medicines do help control those symptoms and make their lives easier. So when you have a patient, or when you're looking after somebody with dementia, you are under a lot of stress. And when you see these things happening, they can be really draining on you. Say, for example, you have, your husband or your mother or father going into a wardrobe and relieving themselves. You then have to face up with you. You find that it's very peculiar. You can't understand why an adult can do something like that. You would expect a child to doing that, but not an adult person. So you might get very upset with what's happening, and you might be angry with them. So dementia is what we call a family care. So when you come and see me, I not only help treat the patient, but I also talk to the family, explain to them what's going on, make them understand what's happening in their brains, to try and see if I can provide a joint care. So having the carers on board is really helpful in managing patients with dementia.
All right. Sorry, just wanted to say good morning to everyone who's joining us on the live stream this morning. Catherine is joining us. And I know that some of you have elderly patients that you are caring for. And of course, this topic will be of interest to you. So feel free to ask any questions on the social media stream, or you can certainly call into the program at 936-BOBO. That's 936-2626. So, I understand that there's also some emerging technological advances, medical advances that will help people who are suffering from Alzheimer's. Can you tell us a little bit about what those are? So
I was just carrying on the topic of people having behavioral problems and having to deal with it. So one of the behavioral symptoms is patients refusing to take their medication because they feel that they're being poisoned or or they may be ill and they can't swallow tablets. So in order to help them, we now have patches, skin patches in Health City. So these are again similar to the medicine called donepezil, but these are available in the form of a patch, and you can apply it either on the body, say the back or the thigh, so patients don't have to don't take them off. And these medicines are really helpful in controlling those behavioral aspects and calming them down. So when you have a father or mother who is becoming more and more agitated and they're refusing to take these important medications that will help them, then we can apply the patch and see if they'll calm it down. So sometimes what happens is if they do not take these medications and their behavior gets more and more worse, they end up coming into the hospital because it's so difficult to look after them at home. What we want to do is try and prevent that, because in a dementia patient in a hospital, we'll find it really difficult because it's a completely different environment, surrounded by strangers, and that makes them even more confused and more agitated. So what we want to do is try and prevent that from happening. So at Health City, we have these patches, and we can use these patches to help in moments of crisis, or also help in day-to-day management. So some patients just don't like tablets, so they prefer to have something, a patch. And so we have those patches available in Health City.
Wow. And how long does the patch, can you tell us a little bit about exactly how it works? So you put it on, how long does it last for? How often does it need to be changed?
So these patches last for 24 hours. So you have to change it every day. You can have a shower on the patch, so you can have the patch on and have a shower, so you don't need to take the patch off because you're having a shower. So they're resistant to water. They sometimes can come off, but you can reapply. Some patients tend to apply a sticky plaster on top of the patch to try and make sure that they're there. Occasionally in the nights they come off, so you find that suddenly the patient is getting agitated and aggressive, and you find that the patch has come off. So you can apply a new patch, or you can apply the old patch if it is still adherent. The patches can be continued long term. We usually say not to apply the patch in the same spot because it can result in some skin irritation. So we just want to make sure that we move it around. So every time you change the patch, you put a different side. But they are really well tolerated, and often patients find it, they don't even notice that they have a patch on.
All right, folks, if you're just joining the program this morning, we're speaking with Dr. Gupta and Ben Mead from Health City. And we're talking about, some of the things that I think we'll all face at some level, whether as a caregiver or maybe someone who eventually will have to deal with dementia personally. But he's a consultant in general and geriatric medicine at Health City Cayman Islands with almost 20 years in general medicine, dealing specifically with older people. So this is so important. And for those of you who are wondering a little bit more about Alzheimer's, it is World Alzheimer's Day coming up on the 21st of this month. And it is defined as a progressive disease that destroys memory and other important mental functions, where brain cell connections in the cells themselves degenerate and die, eventually destroying memory and other important mental functions. So it can cause confusion in people, but there are treatment options available. And, obviously you want to speak to an expert like Dr. Gupta to find out exactly what those are. So he's talked about a few treatment options already that are available right here in the Cayman Islands at Health City. I wonder, in terms of prevention, has there been anything? I've read a little bit that, one's even diet and exercise in your younger years can certainly lead to perhaps delaying the onset of some of these cognitive, issues a bit later on in life. So what has your, personal experience been?
So we now know that we can slow down dementia if we can intervene in the middle life. So patients who are aged between 40 to 65, so we can assess them if they are high risk of dementia, so the dementia risk assessment. And what we found in randomized trials is by combining diet, healthy diet, exercise, cognitive training, and also management of blood pressure, diabetes, all these things that can cause vascular disease, we can definitely slow down the process of dementia, and we can even sometimes prevent patients from developing dementia, particularly in this high-risk group. So it is very helpful to have that assessment. So particularly if you have somebody in your family who have dementia, you may be at higher risk, or if you have problems with high blood pressure, diabetes, then it is something that you would like to consider and have a health screening. So we do also have a genetic test that can tell us whether or not you're slightly at a higher risk of developing dementia. And when you have that test positive, we're kind of more aggressive in terms of managing the blood pressure, the diabetes. We're more forceful in terms of making you sure that you have a healthy diet, and also making sure that you exercise and continuously stimulate yourself in terms of your memory. So those are the things that we can do to definitely slow down or even prevent dementia from happening.
Right.
So, Dr. Gupta, so many of us are going to try to self-diagnose and try and figure out things. You mentioned some of these cognitive activities. So for people like Sandy and myself who are now wondering, are we in that bracket where we now need to go and get checked? What are some of the things we can do to keep our brains fresh?
So the most important thing is to make sure that you have a healthy diet and physically active. So that's definitely important. You may have family history of blood pressure, diabetes, so you're at a higher risk. It's important to get that checked and make sure that you have treatment for that. But with brain, they say use it or lose it. So you need to challenge yourself. So the cognitive training that they did in the trial is basically computer games. So they become more and more challenging, and you try and see if you can get to these challenges and keep your brain active. But reading, listening to music, all these are very helpful in terms of helping our brain. We also have to touch on alcohol. So excessive alcohol consumption, unfortunately, can lead to problems with memory later on in the life, either because of a deficiency of a vitamin called thiamine, but it also could be because of a direct effect of alcohol on the brain. So we tend to develop shrinking of the brain. So it is important that we have evaluation of how much alcohol we can drink. I'm not saying that you should stop drinking alcohol, but we need to try and see if we can maintain it to a recommended limit.
We're no longer 19 and trying to prove to the world how great we are, and realizing now with hindsight that that's not how you show the world that you are great, right?
Yes. We do have a listener to the program who sent through a query in the WhatsApp line. So this person says, good morning, Sandra. Can you please ask if insurance covers the assessment and also what the cost is? So Ben, what's the best way for people to, get information about insurance coverage and cost of some of your services?
Okay, so the best way to deal with this, because it will be on an individualized basis, we all have different plans and whatnot, would be to contact our info line, which is by sending an email to info@healthcity.ky. That's info@healthcity.ky. The team is there monitoring that, and they will steer you in the right direction. Or if you're one of those people like me who is on the go and you figure it's easier for me to call, 640-4040. So that number is 640-4040. Let them know the particular questions you have, and they will point you in the right direction. And sometimes persons like myself get involved to ensure we get the right doctor and get all the answers for you.
All right, we've got Soka who says, I'm not ill and I can't swallow tablets. Water goes down, tablet stays. Not today. Thank God for gummy vitamins.
It took me 40 years before I was able to swallow my first pill.
Wow.
And now I have to do it.
Yes. Yeah, I feel like there's probably a little bit of a trick to it, but yes, it's more difficult for some people. So Soka is making fun of how we're pronouncing the word Alzheimer's. She says old timers. So close enough. Good morning to you. And Soka says that crossword puzzles are supposed to help keep the brain active as well. So I guess not just crossword puzzles, but any sort of mental agility activity that really forces you to think about things. What other sort of activities can you engage in that will help your memory or your cognitive?
One of the things that they say is thinking on your feet is also very helpful. So reciting a story while you're walking definitely helps enhance your memory. So that's, again, one of the exercises that we tend to do, advise our patients to, read out a story that they can remember while they're walking with their partner. And that kind of cognitively stimulates them while they're being physically active. So doing two things at one time is also very helpful.
Wow.
I'll have to try that one.
Yes, because it is challenging to do two things because they use very different portions of the brain. but to do two different things at the same time. Yes. Very, very interesting. So, folks, if you have any questions for a guest this morning, don't let this opportunity pass you by. 936-2626. I feel even sometimes I'm here multitasking on this show, and I become very aware that I'm using very different parts of my brain to be able to pull it all together. So again, we're here talking about cognitive loss issues, whether it's Alzheimer's or dementia. You've got treatment options are now available for you. Now, can we talk a little bit about something called the Parkinson's pen, which is also available locally at Health City? What is that?
So I'm also a Parkinson's specialist. So I specialized in Parkinson's while working in the UK, and I've done Parkinson's for 18 years. It is unfortunately a disorder that affects every part of the body. So it affects memory, it affects your physical function. So you might remember seeing patients with Parkinson's having a tremor, having shaking in their hands. You might see that when they're eating or when they're holding a cup and they have a shaky hand. You might see patients with Parkinson's walking about and you see that they're kind of shuffling or walking slowly, kind of slowly bent over. So it does have some physical aspects to it, and it's very obvious to see whether or not a patient has Parkinson's disease. Now, we have effective treatments. The majority of them are tablets, which help control Parkinson's, and they do make a big difference to lives. But these treatments, unfortunately, are not too effective as the disease progresses. They become kind of shorter acting. So you take a tablet and you find that it's helped you, but it's not lasting long enough. Sometimes these tablets take a long time to show its effect. Say, for example, you're sitting at the table ready to have your lunch and you find that the tablet you've taken has not kicked in, so you're quite shaky and you're not able to even hold a cup or hold a knife and fork, so you can't feed yourself, and that can be quite frustrating. Or it can be possible that you're walking about outside and you suddenly find that your walking is not so good. You become very slowed. You can suddenly sometimes get what we call freezing, where you're stuck to the spot. You can't move forward, and that can be really frightening to patients. Say, for example, you are in the middle of the road, you can be a danger to yourself and to others. So you really want to try and avoid that. And that when that happens, patients tend to become very, very very afraid of going out, so they tend to become socially isolated. They don't want to go out, venture out. They want to stay at home because there is nobody watching them at home. It is also very embarrassing to be found stuck in a road and not able to walk. So what these pens do is they help patients relieve these symptoms. So, for example, you're sitting to have your lunch and you find that your tremor is there. You can take this pen and that will relieve the tremor very quickly and enables you to eat and drink without having much difficulty with shaking. Or if you're going out to shop, you might say, okay, let me give myself this pen so that I can walk normally when I'm outside. So it does bring about a quick relief, and it lasts for about 2 to 3 hours. So it's a pen-like device. It has a very small needle at the tip. So it's like an insulin pen. So you just have to press a button and that kind of injects a small amount of medicine underneath the skin, and the medicine gets into your system very, very quickly. It is painless and it's easy to do. Most patients tend to inject themselves, but sometimes if the shaking is too bad, they can ask their partner to do it for them. So we now have those pens available at Health City, and so we can offer this treatment to patients with Parkinson's disease.
And is there a limit on how often you can utilize a pen? Could you use one every day? How long does it last for?
So most patients tend to use it 4 to 5 times a day, but it can be used up to 10 times a day, depending on how your control is. So you still need to take your tablets. So the tablets still remain, but the pens are kind of boosters from time to time. And you can use them every day. You don't get tolerance to these pens. They work for all stages of the disease. And one pen, once you inject yourself, the effect lasts for about 2 hours.
Okay, very good.
So some patients find just carrying the pen with them is enough because they just have this confidence that it'll help them when they need it. And, mind over matter is what they say. So you can still feel confident, not have to use the pen because you feel much more relaxed. And you're able to engage your brain more effectively.
Wow. So we do have a question that came in on WhatsApp. This one says, can your guest touch on dementia and incontinence? So Again, you were talking a little bit about, you give an example of someone, might forget where the bathroom is actually located, but there is a link between, these two issues as well.
So dementia can cause incontinence due to several problems. One is obviously, as you said, they are confused and they don't know where the toilet is. The other problem with dementia is sometimes they are not able to get to the toilet in time. So physically they have become frailer. So again, that can result in incontinence. But we also notice that the bladder becomes overactive in dementia. And as we get older as well, we can get these overactive bladder. So you find that you're having to go to the toilet frequently. Your bladder is not retaining as much urine as it should, and therefore you're having to rush to the toilet. So there are several aspects to incontinence in dementia. So what we do is, one of the evaluations we do is try and find out what exactly is causing the problem with the waterworks. So we can definitely obviously help manage those problems. Incontinence is particularly disabling and does have a big effect on carers, because they'll have to clean up and do things like that. So we really want to try and prevent or help them in any way we can to try and help. So we have medicines to treat overactive bladder, calm the bladder down so that they don't have to go frequently. If you're not able to, help control the problems with continence, we have what we call containment products, which are very easy to apply, very easy to manage at home. So these can be pads, or these can be what we call condom catheters that go over the penis and collect the urine into a bag. So there are lots of things that we can do to help with incontinence.
So the most important thing, folks, is, if you're noticing any symptoms in yourself, or perhaps your elderly parents or aunts and uncles, like people in the family, don't be afraid to have a consultation with experts like Dr. Gupta. That's what they're there for. And the sooner you are aware of what's going on and have a proper diagnosis, you can actually look at effective treatment options. And as he has just pointed out, there's treatment options for everything, from the primary cognitive issues to even some of the secondary things that will happen, such as incontinence, and, to help you better deal with those things. So the Parkinson's pen, we understand, is only available locally at Health City. And of course, again, that's a viable option for you if you are dealing with Parkinson's disease. So are there people who can't utilize the Parkinson's pen, or can that be used pretty much by everyone?
So we have to check whether or not the patient responds to Parkinson's pen. So not all of them respond. About 70% of patients respond to Parkinson's pens. And some patients may not have what we call a typical Parkinson's disease. They have what we call atypical Parkinson's disease. And those patients, unfortunately, do not benefit with the pen. So it really is very helpful in patients with Parkinson's disease itself. So in order to test whether or not they respond, we do what we call an apomorphine challenge, the pen challenge. So you come in, and what we do is we train you how to inject yourself. We test you at various doses, 2 milligrams, 4 milligrams, 6 milligrams, see which one is most effective for you. And then we send you home to use the pen at that dosage. It usually just takes half a day to do the assessments. And it is a detailed assessment. So once we give the two, say for example, I give you a 2 milligram dosage, I then see how your tremor is improved, how your mobility is, and then I repeat it with 4 milligrams and say, okay, 4 milligrams, you have a better response, and maybe this is the best response. This is the best dosage for you, and you can use 4 milligrams when you go home. So it's that kind of testing we do for pens.
So it's a bit of a tweaking of the dosage and everything. Wonderful. Yeah. Okay, good. So, of course, you work in conjunction with other supporting, professionals, including physiotherapists and occupational therapists. So if we can talk a little bit about the important role of those experts in, helping with any sort of cognitive decline issues.
So, obviously, with any illness, or as we get older, we have multiple complaints. We have musculoskeletal complaints. These can affect our balance, and they can result in us falling over, causing further damage. So one of the assessments that we do is test your balance when you come to the clinic, see how your balance is, and if your balance is affected, then we try and see if we can get that helped with the help of a physiotherapist. So there are a few key tests that we use to test balance, and these are balances that help us come to an assessment as to whether or not they will affect you while you're walking, and whether that will increase the risk of falls. So we can use balance exercises to help correct the balance problem, or we can give you equipment that will help improve your balance and keep you stable and prevent you from falling. So that's when we tend to say, okay, we need the physiotherapist here to try and help you improve your balance, give you a set of exercises, go through those exercises. And sometimes it's a program. So, we tend to do these exercises every week. So you have a good understanding of what these exercises do to you and how you can practice them at home. So for that, we didn't get to see the physiotherapist. Then we also have occupational therapists. These are therapists who try and help you in terms of your daily activities. Say, for example, you're having difficulty getting in and out of bed. So they can provide you with a bedside rail, which you can hold on to so that you can still keep your independence. You don't have to rely on somebody to pick your feet up into the bed. You can do it yourself by using these equipment. Or you have difficulty getting in and out of toilet, they can provide you with equipment that will help you, such as a toilet chair, a high chair, which can help you get onto the toilet easier and get out of the toilet. I work very closely with the therapists, mainly because sometimes we also have what we call blocks to rehabilitation. So what we're trying to do is rehabilitate whatever your problem is so that you go back to where you were. And if you have a block to it, say, for example, you've seen a physiotherapist and you're doing these exercises, but you find that when you're doing these exercises, you're becoming a little dizzy or lightheaded. The physiotherapist will then say, okay, you know what, I can't do this with you because I'm worried that you might fall over while you're doing the therapist. So then I tend to get involved and say, okay, what's causing the dizziness? What can I do to help? Is there any treatment that's causing these problems? So I can work very closely with the physiotherapist to try and make sure that you get the best out of those therapists as well.
Right.
Sandra, I think what's the thing coming out of everything I've been hearing from Dr. Gupta speak about this morning is we always looked at, we're going to get old and quality of life goes down. But thankfully today, with the advances in medicine, the availability of the specialists we have, like Dr. Gupta, they can look at you as a whole person and ensure we age gracefully.
Yes.
And the support is there. So it's not that, okay, well, I have this issue. It's been bugging me. I'm going to let it fester until it becomes a major problem. The support is there along the way. If life expectancy is growing, we should want the quality of life with our expectancy to grow as well. So that's one of the good things about having people like Dr. Gupta with us.
Wonderful. So, folks, I'm going to put my hand in my little, what do we call it over here? Our little surprise basket and pull out a gift certificate this morning. So I've got a trivia question for you. It's actually pretty easy, but it's a little bit tricky. So in 1906, a German physician first described what he said was a peculiar disease, one of profound memory loss and microscopic brain changes, which is the Alzheimer's that we're now discussing. What is the name of this German physician? So 936-2626 is the telephone number. We've got a gift certificate for some fuel this morning because everybody needs a little bit gas in their vehicles. So give us a call if you think you know. Oh, look at this. You guys are so smart. Straight out of the barn. Good morning, caller. Was it that easy? Straight out of the barn. Hi, caller. You got to turn down the background radio there and tell me what you think the answer is.
Sorry, you can see what I'm doing. Good morning, everyone. You can see what I'm doing this morning. It's my birthday, but I'm listening to
happy birthday. Happy birthday.
Happy birthday.
Thank you. I was actually going to call in to speak with the doctor and Ben, but I heard you. I know the answer to the question, but I don't think it's fair since I am the Alzheimer's and Dementia Association in the island.
Okay.
I don't think it's fair for me to answer that question.
Okay.
Yeah, I don't think I give somebody else a chance.
Absolutely.
Yes. But I just wanted to say an excellent program because, we're Alzheimer's Month and we started Alzheimer's Association back in 2010. And we just had an information desk at Hot City this weekend. And unfortunately, I haven't met the doctor. I've worked closely with Dr. Ramesh, but I haven't met Dr. Gupta. But I think I may have to arrange a meeting with him. Very interesting. I've met during this period of my life. I've met many doctors all over the world, and And having someone in treatment is so beneficial because every day I receive calls of new diagnosis, people are getting diagnosed, people that want to get a diagnosis, and it's always great to know that there is someone in Ireland that we can send that individual to. But not only the medical part of it that they need, but they also need support once they've gotten the diagnosis, and that's where we step in. We didn't diagnose anyone, but we are here to support the family members, the caregivers, and so forth through that journey up until the end of the journey, which could be a very long time. And I just want to say it's a very good program this morning. And Dr. Gupta, I will be reaching out. This is Dorothy Davis, Alzheimer's and Dementia Association of Cayman Islands. I will be reaching out to you. Hopefully we can work together in the future also. And then I guess I can do it via Ben. Because I was going to reach out to him in relation to the 21st of September, which is World Alzheimer's Day.
Yes, and that's one of the things on our agenda is to ensure that you sit down and meet with Dr. Gupta, because I know your association, the work it does in the community, it's a natural synergy. So that's one of the things that we will have happen this month. So you should hear from us shortly.
Yeah, I've also signed up as a volunteer for Alzheimer's Disease and Dementia Society in Cayman.
Yeah.
So they were on Health City last Saturday, so I was there with them. So yeah, please, I would love to work with you. I have seen your website, and I know you have lots of links to Alzheimer's disease leaflets, and I think they're wonderful leaflets. They really help, educate patients and their carers.
Well, thank you very much, and I'm looking forward to that. Excellent show, Sandra.
Yes.
You all have a good day. I'll wait for someone else to answer the question. I will do it.
All right, I appreciate it.
All right, gentlemen, have a wonderful day.
Okay, have a great day.
Right.
All right, folks, we still have a live question out there. Marshall gave a guess, and that is not the correct answer. So again, the question is basically the name of the person who discovered this disease back in 1906, a German scientist. So Ms. Vernita says, good morning, CMR and guests. I suffer from fibromyalgia and have really bad short-term memory loss. How do I know if it's not Alzheimer's? Well, the best way to know is to simply go in for a consultation, I would think.
So yeah, definitely it'll be helpful to see you, because obviously there are some medicines that can affect memory. There are some other disorders that can cause reversible memory loss. So, as I said, hypothyroidism, vitamin B12 deficiency, some infections like Lyme's disease and things like that. So it's important to look at those and see if we can reverse any of these diseases so that they can help improve your memory. But there is also a scale called AD8. And if you go on Alzheimer's disease website, it's a scale that you can self-administer, and it'll tell you whether your memory loss is because you're getting older or whether it's because you have an underlying disease such as dementia. It's a very simple scale. The important aspect of that scale is you are basically checking yourself from 6 months ago. And it'll ask you, has there been a change to the way you think in the last 6 months? Have you been more forgetful in the last 6 months? And you have to answer with a simple yes or no or don't know. And if you score more than 2, then it's probably best to come and see a specialist.
All right, folks, we have a live question still out there. And in the meantime, here are 10 warning signs and symptoms that if you notice you have a few of these, you might want to, again, schedule an appointment with Dr. Gupta. So number 1 is memory loss that disrupts your daily life. So that's one of the common things, especially in the early stages, like forgetting things that you've learned, like learned information, and forgetting important dates or events, asking the same question over and over again, and increasingly needing to rely on memory aids such as reminder notes or electronic devices or family members for things that you used to be able to handle on your own. Of course, nobody remembers phone numbers anymore, because I feel like we've all become reliant on our smartphones. We just save the information, and like literally there's probably 2 phone numbers that I can remember, maybe 3. You do have a caller who is joining us. Good morning, caller, and welcome to the program.
Hello.
Hi, morning.
Yeah, I'm still ready to answer that question.
Yes.
Well, it was discovered by a gentleman called Dr. Altheimer. His first name is Alois.
Yes, very good.
Dr. Alois Johnson. How's that?
Very
nice having the disease. Nice having the disease named after you.
Yes, I know, right? Well, congratulations. We do have someone who'd also mentioned the correct one on we'll call you. It sounds like you got a little bit of background there, but we'll call you after the program. Okay, thanks so much. Bye-bye. So yes, both Soka kind of guessed it, but Soka, you're not in Cayman, so we're going to pass that by. Deania also got the correct answer, so we will be giving you and that gentleman each a gift certificate for getting the answer. So wonderful, congratulations! Like I said, it was actually pretty easy, so making it easy peasy on you guys today. So we were just going through a list of some of the things that you can be and look out for. So one was memory loss that disrupts your daily life, giving you some examples there. Number two, challenges in planning or solving problems. So this is quite interesting. But many people with dementia, for example, may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a family recipe, for example, or keeping track of their monthly bills. If you have difficulty concentrating and take much longer to do those things, then again, that can be something that you want to look into further. People with Alzheimer's, number three, have difficulty completing familiar tasks. And sometimes it can be as familiar as driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game. Trying to remember how to set the microwave settings or how to record a TV show that you've done 1,000 times before. Confusion with time or place. So again, people suffering from this disease can lose track of dates, seasons, and the passage of time. They may also have trouble understanding something if it's not happening immediately. And oftentimes they forget where they are or how they got there. So again, confusion about things like the day of the week and trying to figure it out later. Number five, trouble understanding visual images and spatial relationships. So for some people, having vision problems can be a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast, again, causing issues with driving, for example. And vision changes related to cataracts. So again, some of these things are all interconnected as the aging process begins to set in a bit more. Number six, new problems with words and speaking or writing. So they may have a problem or trouble forming or joining a conversation or following a conversation, I should say. They may stop in the middle of a conversation and have no idea how to continue, or they may repeat themselves. They may struggle with vocabulary, have trouble naming a familiar object, or use the wrong name. For example, calling a watch a hand clock. That's interesting. Number seven, misplacing things and losing the ability to retrace steps. So again, a person living with Alzheimer's disease may put things in unusual places, and they may lose things and be unable to go back over their steps to find them again. He or she may accuse others of stealing, especially as the disease progresses. So this is really sad because I've known of caregivers who've had to deal with people who have either dementia or Alzheimer's. And it's a very, very difficult job because oftentimes they think people around them are doing things to them, that is causing their cognitive issues. So they might accuse people of stealing, or sometimes even accuse people, Dr. Gupta, of abusing them when that really isn't the case, right? So they may accidentally walk into things and don't remember. So they end up with bruises and stuff, and they think it's because of maltreatment from a caregiver. Yeah. Number eight, decreased or poor judgment. So individuals may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money, or pay less attention to grooming or keeping themselves clean. So again, neglecting to do things like changing the oil in their car when maybe that was something that they were a bit meticulous about before. Number nine, withdrawal from work or social activities. So a person living with Alzheimer's disease may experience changes in ability to hold or follow a conversation, as said earlier, And as a result, he or she may withdraw from hobbies, social activities, or other engagement, and they may also have trouble keeping up with a favorite team or activity, and they become uninterested in family or social obligations. And finally, number 10, changes in mood and personality. These individuals may experience mood and personality changes. They become confused, suspicious, depressed, fearful, or anxious, and may be easily upset at home, with friends, or when they get out of their comfort zone. So those are some of the things, the irritability that might come with it. So just some of the things to keep an eye out for.
Yeah, exactly. So you might have mentioned lots of time driving things and, ability to drive safely. And that, again, becomes an issue. And one of the reasons why patients don't want to come and see a doctor is because they're worried that they may have to stop driving. As I've said, there are several things that can affect memory, and it is important to assess them and make sure that you haven't got any reversible causes for memory. So we can do all these assessments and ensure that you're safe to drive as well. So obviously driving when your memory is poor because your judgment is not up to mark can be a risk to others. So we need to be careful about taking that kind of risk and carrying on, when your memory is not good, because it can result in harm to others. So it's very helpful to come and see a specialist and have this diagnosis, have an evaluation of memory, understand the risks that you're taking, and then come to a plan that will help you.
Mm-hmm. Very good. Ben?
Yeah, no, that was great, what Dr. Gupta went through. And I know we're short on time and you have other important guests coming up. When you were on with Blake and Erin, you recapped the health screenings that we mentioned we're doing with Minister Turner in Prospect. And I've seen some commentary about it. I just want to clarify one or two things.
Yes.
Minister of Health, a natural nexus with whom we should do something like this. So we thought we would start in Prospect. We're having discussions with MPs across all islands where we would come into the community and do these different ones. So, of course, on Tuesdays here, you'll hear about it. We'll have the details out there. We just felt it was appropriate. If we're starting these in the community, we would start with the Minister of Health and her constituency. So we start with Prospect, and we're doing prostate cancer screenings and some talks next week at 7 next Wednesday at her office on Marina Drive. But by no means was this, we're just focusing on Prospect. This is going to be spread far and wide. I was speaking to MPs up to last night. So it's something that Health City has taken upon itself as a corporate member of the community, that this is something that we're doing. Again, get you screened, get you eliminated from worry, or identify early on that there might be something. This has nothing to do with the political side of things. This is Health City as a good corporate entity in the community wanting to do something like this and to highlight various cancers and screenings and treatments that are available. So stay tuned. There's lots of good news around that. But I know some people instantly started wondering why Prospect. It just was the Minister of Health invited us to a meeting, and we found that to be the perfect opportunity to start speaking about it because she is the Minister of Health.
All right, so folks. Everything is
nothing up our sleeve other than helping.
Yes. I feel like sometimes we need to put it out there. Not everything is a conspiracy. It's okay, folks. Yes. All right, guys. Thank you so much to Dr. Gupta and Ben Mead for joining us this morning. Again, the 21st is right around the corner. We'd actually like to invite Ms. Dorothy on the program if she'd like to come on and talk about what her local organization is doing as it relates to Alzheimer's and dementia. She does really a lot of important work here. And I know she also offers support for family members, and she has like a seniors program where senior citizens can get out and do knitting and crafting and different activities to kind of keep themselves active, because as you come into your senior years, probably the worst thing you can do is stay home and do nothing all day or just watch TV. You've got to remain active, continue exercising a bit, keeping the brain active. And, look at the Queen. She's a perfect example. Worked right up until 2 days before her passage. She was still, in her routine, had her little corgi dogs that whenever was possible, she would walk with them and stuff as well. So let's keep active, folks. Mental and physical wellness, emotional well-being, so incredibly important to your overall health. So again, gentlemen, thank you so much for joining us this morning.
Thank you for having us.
Thank you very much,
Sandra. So up next, folks, we've got the governor after this quick message.
For over 7 years, Health City Cayman Islands has provided life-changing and life-saving medical care for the people of the Cayman Islands at our hospital in East End. During this time, we have become an integral part of the community and now focused on connectivity and collaboration. Our vision is to make an even greater impact on the quality of healthcare for the people of our islands. In summer 2022, we will open a 70,000 square foot state-of-the-art hospital built on 3 acres of land at the southern end of Camana Bay, bringing much-needed specialized medical services closer to where people live, work, and play. Camana Bay, located at the heart of 7 Mile Beach, is home to schools, businesses, shops, restaurants, and entertainment. And now, Health City Camana Bay, a $100 million world-class hospital. Health City Camana Bay will include an advanced cancer care unit, offering bone marrow transplantation and the latest cancer treatment technology. It will contain a modern neonatal intensive care unit, emergency and critical care, purpose-designed operating rooms for surgical specialties, such as cardiology, neurology, and orthopedics, and robotic operating systems. A master plan for improved health care for the people of the Cayman Islands. Ready to meet the needs of our patients here and now, we have already established a footprint in Camana Bay with the opening of our clinic. Offering short wait times, extended opening hours, including evenings and weekends, and the ability to see our world-class doctors closer to where our patients live and work. The clinic has bright, comfortable waiting areas and treatment rooms, friendly staff, expert care, lab services, and diagnostics. Reflecting our operating philosophy of patient-centered care, convenient access to our specialist doctors allows our patients to focus on getting better rather than getting to appointments. With our unwavering commitment to our community and the thousands of patients who trust us to care for them, we look forward to building healthier communities in a place where life unfolds, blossoms, and thrives. Welcome to Health City Camana Bay.
Welcome back to the Cold Hard Truth. I was just a bit of multitasking there, responding to someone who was asking, why hasn't my situation been highlighted on the Cold Hard Truth yet? And this is what I always say, folks. Yesterday I said this, and I kind of had to chuckle at one of our usual listeners, El Ray. I say that God helps those who help themselves, and apparently El Ray says yes, God also helps those who CMR can help. But you've got to be willing, folks, to, if you have an issue or a problem, you have to be the storyteller. You have to be willing to come, just like yesterday with Ace. We'll talk about that a little bit later on. But, Ace came on the program and told us how he has been victimized by someone who's abusing the immigration system. And you have to be your own voice in a lot of instances, and we will provide you with the conduit and the opportunity to get your stories out there. But, in the past, we've gotten into little ticklish legal situations because we try to be your voice, and we may not have all the questions or all the answers, I should say, to be able to do that. So there's a good logical reason now why we have made some very necessary adjustments. But on that note, we have the Governor, His Excellency, the Honorable Martyn Roper, who's joining us this morning. So we'd like to thank him. Good morning, sir.
Good morning, Sandra. How are you today?
Very well, thank you. And thank you. We know that you're super busy at the moment, so we really appreciate you taking a little bit of time out of your busy schedule to join us. And of course, the reason why we wanted to have you in the show is that last week we got the very, very sad news that the late, Her Majesty Queen Elizabeth II had passed away. And so we wanted to just touch bases with you, hear your thoughts on that occasion. I guess we all knew it was coming at some point, but it was still a little bit unexpected, right?
Yeah, no, it was. No, and thank you very much for sort of inviting me to come on. It was very unexpected. I think, yeah, as you say, we did know it was coming. Her late Majesty was 96, but I think the sudden sort of deterioration. I mean, to be able to see in your 15th Prime Minister and see off, as Boris Johnson characteristically put it, her 14th, 2 days before she passed. I mean, she was working and doing her duty and giving service right up to the very end, which I think just epitomizes everything about Her Majesty. She's just the most incredible lady who has given the most amazing and outstanding service over the years to over such an incredibly long period to so many people. So it's a very sad moment, and I've been touched and I thought we had
there we go.
Did you get me back?
Yes.
So, I was just saying, I thought we had a wonderful session in the Parliament yesterday. I was grateful to Speaker Bush for organising that so quickly, and there were some wonderful speeches by every member who was there who spoke. And yeah, it's a big moment in our history, and emotions are a bit mixed. I mean, we feel incredibly sad about the late Queen's passing, but we also proclaim a new king, and that's a sort of a joyful moment. It's something that's built into our constitutional system, but I know a lot of people have found that sort of uncertain and unsettling. But I think really yesterday was just about paying tribute and passing on our condolences to Her late Majesty.
Yeah, absolutely. And so there are a number of things that will be happening on the local calendar. We did see on Friday that there was the 96 gun salute. And I know that all of the territories, some of them are now here in the Cayman Islands for the CTO conference. And they were discussing yesterday how they kind of, did their own version of a gun salute. So not all of them did 96. I think someone said they did 20 something. I'm not sure how they came up with that number, but we obviously did 96, one for each year of her life. And so there was that ceremony at the governor's residence. And then there was another, the proclamation, which was done on Sunday and then yesterday. So you guys have been quite busy. So tell us a little bit about, this is obviously your first time in your life doing this. So how has it been for you? Because she was on the throne for some 70 years. I mean, truly amazing.
She was. It is a huge moment. I mean, I think all of us at the proclamation on Sunday singing God Save the King for the first time and talking about His Majesty. I mean, that was a moment, and a lot of people told me afterwards they were quite emotional the first time they sang that, because it really does bring it home to you that Her Majesty has very sadly passed away. But I do want to say thank you to everyone in Cayman for all the sort of messages and the way that the government and protocol and everyone have responded and organized the various events. I think there's a lot happening to pay our respects and show our deep sympathies for the royal family. And the Premier and I will be traveling on Thursday to London for the funeral. The funeral will be next Monday, the 19th. And absolutely right that the overseas territories are represented at that with the realms, and I think there'll be about 2,000 people there. President Biden, I see, has confirmed, and there'll be so many world leaders going to that. Before the funeral, we're invited to attend the lying in state, so we'll be able to go to Westminster Hall and pay our respects at the coffin of Her Majesty, which will clearly be a very moving moment. Our Mrs. Roper and Mrs. Panton and Dr. Tasha Garcia are also involved in that event. The King, who is having an incredibly busy time, and you can only imagine the personal emotions. This is a personal tragedy for the family first and foremost, but then you add to that all the ceremonial and meetings that they've got to do this week, and the King is hosting a reception at Buckingham Palace on the Sunday evening, to which the Premier and I will go, and there will be a reception hosted by the Foreign Secretary after the funeral as well, to which all Overseas Territories representatives are going. So where the Overseas Territories are absolutely center stage and fully part of all these events. But it is a huge moment in our history. It's the end of an era, and it's the beginning of a new era. King Charles III. We were lucky. He's been here very recently, so that was, I think that's really, really, really nice for Cayman. And he was so touched with the affection shown to him. Many thousands of people came out to see him and the Queen Consort, and I know he enjoyed very much that visit. Like Her Majesty, if you think about the progress Cayman has made over the 70 years of her reign, it's just extraordinary. So I know they both share Cayman's pride in the progress that has been made over that long period.
Right. And of course, the National Day of Mourning will be, for most people, the 19th, which is this coming Monday, for the funeral service. And what that means here in the Cayman Islands is it will be a public holiday. Are you aware of any additional elements of mourning, that like official activities that will happen here in the Cayman Islands?
I know we've been sort of having lights, I think the blue lights on Government Administration Building and in the town hall in Georgetown. Churches will ring their bells. We'll be having a minute's silence. I think there's lots of things. We will have a commemoration service probably after the funeral. I hope that will be at Emsley Church, but that's still to be worked out. So protocol will put out obviously all the specific details.
Right.
But yeah, it is we have made it a public holiday. Unfortunately, the time difference means that I think the funeral starts at 11 o'clock UK time, which means it's 5 o'clock in the morning here. So it's very early. But I'm sure it will be sort of shown again and repeated. So it makes me proud as governor that the extent of the way we are commemorating and really passing on our condolences to Her Majesty. We have so many activities going on across the board. And thank you to all those who came out to the proclamation of the new King at Government House, and people laid flowers outside Government House. We have people laying flowers outside Government Administration Building. And those two visits the Queen made, people still talk about those today as if it was just yesterday. When I travel around and talk to people who met Her Majesty and the Duke of Edinburgh at the time, and there is, I think, Cayman, I think there is huge affection for the royal family. I know it's not for everybody, and people can have whatever views they wish to have. We live in a democracy, and it's perfectly proper. People have different views, and I know there are people who question, Britain's history and what that all means. But I don't think anyone could question the way and the manner in which Her Majesty has carried out her service to people over 70 years, and the role model and example she sets is something all of us can take something from, and the way she has behaved and handled herself with dignity, and absolutely impeccable throughout 70 years. And I just think she's just an incredibly inspiring person, whatever you think of some of the other issues that are out there and that people raise.
Yeah, absolutely. And so we do have a comment that has come in via our WhatsApp. And this person says, morning, Sandra. This is why I love our governor so much. He is so personable, and I will miss him when he's gone. The next governor has big shoes to fill. Please let him know that. So
that's nice. I'm not going just yet. I'm still here for another 6 or 7 months.
Yes, you're here into early next year, right?
Yeah, probably. Yes. I will leave at the end, probably towards the end of March. So there will be a new governor probably sometime mid-April, a little bit after that. There's usually a little bit of a gap.
Yeah. All right, folks. So if you have any quick questions, we're sort of limiting it this morning. We know that the governor, again, is very, very busy. He's preparing to travel in just a few days. But if you have anything specific, that you'd like to share about the passing of, the late Queen Elizabeth II, 936-2626 is the telephone number. And of course, you can always send your comments in on the social media streams as well. So lots of activities planned here in the Cayman Islands. I thought that the one yesterday, which Mr. Bush, Speaker of the House, arranged a special sitting in Parliament for the parliamentarians to be able to share their views, and a lot of them shared personal experiences, maybe having met her on the 2 occasions that she did visit the Cayman Islands, I thought was quite nice and quite interesting. And profound. There's only one that kind of caught me off guard that I was a little bit surprised by. We'll talk about that after the governor has left. That one was.
I don't mind you raising. You can talk.
Yes, no, I must say that obviously we live streamed it on our show, and the minister from West Bay, is he North? Bernie Bush, the Honorable Bernie Bush, kind of caught me off guard because his lasted all of 10 seconds. He basically said, may she rest in peace. And, God save the king. And that was it. So I think a lot of people were left questioning how he really feels about the monarch. But I must say that I personally found it, and again, people have very, very strong views about colonialism and the monarch and all this stuff. And I think that there's certainly a place and time for those types of discussions. And, anytime you have the death of someone that's part of the monarch, these questions naturally come up, which I completely understand. And there are a lot of questions, but, the Cayman Islands made a decision back in the 60s to remain as part of the of the English family, if you will. And most people recognize that decision has suited us well. And, if that changes, then the people themselves will have to decide what that means for them. And they'll have to make decisions going forward. But I think in the meantime that there has to be a certain level of respect. And what I found peculiar is I think that perhaps he's of the opinion that he is representing himself in these matters and not his people, because I'm sure if he polled his constituents, most of them would have expected him to give a bit more than 5 seconds worth of comment on this momentous occasion. He'll probably never live really to see another one. Many of us probably won't. So
I'm not going to comment on sort of individuals. Comments. But what I would say is that I think the relationship between Cayman and the UK is really constructive, really, really positive, and I think it works very well. I don't sense I talk to a lot of people, I don't sense anyone really out there, apart from perhaps a very, very small minority. We've always got a small minority who question that relationship. But what I would say is that the royal family, the Queen, Prince Charles, other members, they've played an absolutely pivotal role in creating that sort of positive and constructive relationship. And to have the new king here 3 years ago, I think was really positive. And for me, the relationship it's clearly up to the people of Cayman where that goes in the future, and that is absolutely clear. But I detect a lot of positive feedback in terms of the UK Cayman relationship, and I don't see that changing in the near future. But obviously it is up to the people of Cayman ultimately.
Yeah. So we do have Romelia who's here wondering when she can get a meeting with you. Again, wanting to talk to you about the police commissioner. I think the last time you were in the program, you had asked her to reach out to your office, but she says that, she's reached out to them and she still has not been able to get a meeting. So she's got some strong words for you this morning about her inability to get an audience with you.
Well, I think if this is the same issue, I think it came up on your show yesterday, and that the deputy governor himself sent you a message saying that he recognised more needed to be done. So the deputy governor is dealing with this, so we don't duplicate or tread on each other's toes. I think it's right that he deals with this. So that's really all I can say. It is. We recognise there is an issue. The Deputy Governor recognised it in a message to you yesterday, and Ramelia, we will absolutely deal with that. But it is
all
the
right,
Deputy
wonderful.
Governor who is taking on responsibility for it.
Yes. Well, thank you again, Governor Roper, for coming on the program this morning. Again, we appreciate how incredibly busy you are. We just wanted to take a few minutes just to have a quick chat on this momentous occasion. Like I said, most of us may not live to see the next, proclamation or new king, because they seem to have very good genes and they seem to last a very long time. So although now King Charles III is 73 years old, he could definitely live another 20 years as king. So it puts all of them in a very interesting situation, because then William will be the second longest ever to have waited on, king in waiting, so to speak. So we do thank you, and good luck with your safe travels on Thursday to the UK. And I'm sure everyone will be representing as well.
All right. Well, thank you very much for having me on. Thank you.
Thanks. Appreciate it.
Bye-bye.
All right. So we will read some of your additional comments. Somebody else says that he's the best governor, that they, by far, the best governor ever is what they've said. Another person said he's not my favorite governor. And I guess he doesn't need to be. Someone else in relation to Bernie Bush says Bernie Bush is full of, you know what? Nobody in his constituency ever sees or hears from him. Where am my little dun? I feel like I need something here to go with that. I'm not even sure which button would be appropriate for that. My goodness. Yeah. Crickets. That's all the constituents are hearing. I don't know. Andrea says Bernie Bush is just being himself, arrogant and rude. What a hot mess. Another member of the Legislative Assembly actually said, let me just pull this one up. They said, have you ever seen anything like that? I was surprised to see him there, as he was one who said adamantly that he was not coming. No respect. So I kind of feel like maybe that was the approach. Like you shouldn't have showed up. You know what I'm saying? If you've got an issue with the whole monarch and the whole situation, and you don't respect the queen, you don't respect the monarch, and you think it's all a bunch of, cockamamie or whatever you want to call it, then when you get invited to make remarks in a special sitting of Parliament, the correct thing to do is simply don't show up. That's the proper etiquette thing to do, as opposed to showing up. And if you didn't see it, I don't even know where it is in the video, but it became very obvious to everyone that you were sending a message, and the message was one of lack of respect, really. And so sometimes we protest by simply not being present. That's the best and most professional way to do it. So yeah, I was kind of put off by it, to be honest. When I saw it, I thought, oh boy. I don't even know what to say. And then the overarching issue is he representing the views of his constituents? And let's be quite frank here. They're the people who gave him this job. They're the people who elected him. So I imagine that there are times as an elected official that you might take a particular view on something, and your constituents may have a different view. And so what do? Are you there to support your view or your constituents' view? The people who actually elected you to public office and who are paying your salary? Yeah. Because I think the vast majority of Caymanians are very, very supportive of the monarch and of our ongoing relationship with the United Kingdom. And the day that it changes, you all have the choice. You want to go independent? You want to have people like Mr. Bush and others having no reins and no controls over their behavior? Then let's do it and see how well that's going to work out for y'all. Because, child, I'm going to be over here sipping my tea and thinking about what other passport I can try to get my hands on to make a quick exit. Because y'all ain't ready. Your politicians are, quite frankly, not ready to run this country on their own. Oh, God, please. Y'all have no idea the degree of corruption and everything else that would be happening in this country if they felt like they had nobody to answer to. Jesus, God, take the bus, dear Lord. Strong Will, good morning. Strong Will says, good morning, Sandy. Bernie Bush is coming like a big waist girl. He's up in his feelings. And yes, it is very, very unfortunate. And he's entitled to his feelings, but I think that his feelings don't trump, representing the people of this country in the most effective way possible. And that whatever that was that he did yesterday, just wasn't it. I was just put off by the whole thing. And, I don't know. Good morning, caller. Welcome to the program. Catherine says, let's do a Henry VIII off with his head, laughing out loud. Good morning to Sir Denny.
I refuse to be entitled in such a derogatory way.
You refuse to be entitled in such a derogatory way. Okay, meaning what exactly?
Why would I want to carry sir?
Oh,
why would I want that?
My apologies. I did not realize that that's what you were referring to. Ooh.
Well, that's what you said.
Well, yes. Is that a dig at Sir Alden and anybody else who has the sir in front of their name now?
Well, this is nothing you have said in the past that you couldn't give me. I would refuse it.
Okay, all right. Mr. Danny.
What I was calling about was you were talking about corruption.
Mm-hmm.
And the irony is I just got off the phone in which you have a Court of Appeal judge who refuses to answer an FOI question, refuses to give a reason for his decision. He just said, that's it, end of story, no more communications without giving a reason. Mm-hmm. Imagine. Listen to me. This country needs some cleaning up. And I hope the governor is listening to this because this is his area of responsibility. Okay? It's not only Canadians doing this. We're now talking about judges doing it. Right? That cannot work.
Mm-hmm.
That is corruption.
So
the judge
FOI,
is not above the law.
But let me just try to understand what it is you're saying, Denny. So the FOI legislation applies to judges, and what information that they would have that would be subject to FOI, because everything they do in the court process is normally a matter of public record. So I'm a little bit confused about a judge, or is it the judiciary that isn't providing the information?
Well, the judge doesn't want the judiciary to provide the information. And you have to realize that they do nothing unless somebody tells them they can do it.
Mm-hmm.
Right? And what is being asked for is a video. The irony is the video was streamed live to the public. So effectively, it's a public document, which the judge does not want to release. So an FOI request was made for the document, and the judge is saying, we're not talking about this. I'm not going to give you an answer, just not going to talk about it anymore. I'm telling you.
Okay. So
I'm telling you, the judge has to answer the FOI law.
Yeah, let me just say
I'm not going to answer.
Yeah, I mean, I think there's some things happening here, but let me just say this, Denny, as it relates to because I myself am trying to get access to transcripts from my own trial, and I'm having a warm time doing that because you have to justify and convince a judge as to why you require the full transcripts. Because I guess it's
that's an extension of your right under Section 7 of the Constitution.
Yeah, well, it still requires a judge to give permission, and apparently you have to make a convincing. You have to give a convincing argument. It's not something that you just get by way of right.
Absolute foolishness. You know what I would like to hear? Why don't you ask the governor to come on and justify why you should beg a judge for transcripts of a case that you were part of?
Well, you can appreciate that he doesn't have any control over there has to be some separation of powers.
You can appreciate that there are rules that are set. Okay? And if they want to change the rules, they can. How do I know that? Because they are all powerful. They can do anything they want to do. Let me give you an example. Whenever the government wants to do something, legislation in relation to the financial industry can change in 4 days.
Well, this is what I was going to say. There might be
whenever the
ways to do
public
it.
wants something done, there is ways to do it.
Yeah, I mean,
the point that I'm making though is that whenever the public wants something done, then all of a sudden, these things take really long. And sometimes it's not as simple as it sounds, and pure excuses. They can do whatever they want to do. And if they're not allowing you to have access to transcripts of a case to which you were a party, that doesn't sound right to me at all.
Well, I mean, the next step would be obviously to have, some sort of judicial review over whatever decision that comes down. I mean, there are steps and there is a way.
You shouldn't have to do that.
Well, that's
why should you have to beg for a record?
That's the process until legislation is changed. And let me say this. This is what I think, Denny, actually needs to happen. This is how simple this is to really fix, right? At the moment, and I kind of ran into a little bit of a situation just last week with even getting access to link for the Canova trial, because people in the judiciary themselves don't even understand, how links are being distributed, and, the Court of Appeal links are up. The public themselves don't even know that they can have public access to court hearings, but it's because the way that the law and the directions out of the court are written, the practice directions or whatever they're calling it, is that you have to go in person and sit down and watch a court proceeding. It is not like the American system where court proceedings are live and links are live. So although you're referring to Mr. Remind me of his name, Baliki? His situation with that video link being available, you have to recognize that he made that available to the public. It wasn't the court that made it available to the public. So what the court does is they put up these links. No, I'm telling you that. Let me explain to you how it works. The court has put up these links, and if you know how to get the link, I suppose you could sit there and watch it if you wanted to. But do you know that if I decided to broadcast those proceedings, that would go against and be, get me in a lot of trouble, because that's prohibited by the courts. So even the definition of wider access to the public and who can have access to these links is a question that, these things need to be.
That may be in your case, but that was not in the case.
It was. Court of Appeal. I'm telling you, it was. You cannot broadcast any of those proceedings.
Listen to me a second. We're not talking about broadcasting. Let me tell you what I did. I know that the court was asked for the link so that it could be shared with the public. Okay? That was specifically stated. But separate and apart from that, I did not use the link. Let me say that again. I did not use the link. I went to the judicial website. I navigated through the menu. I found the courtroom number and just clicked on it, and it was available to the public. So in other words, I wasn't using a link that was only intended for some private viewing. No, the court was broadcasting
I understand that. But let me ask you a question. Are you sure?
But I'm not talking. Yes.
Are you? No, you don't. You don't know the question yet, so you can't possibly say yes because you're not psychic. So my question to you is: are you sure that that video recording or that video link was recorded by the court? Yes. So they do have a recording of it, not the stenographer who's sitting there taking manual notes.
Yes, I'm sure of that.
Okay. Well, that probably, if you go again and look at the Chief Justice's practice directions, it probably goes against, like, if they provide it to you, their argument is going to be, well, this is now broadcasting it, and gives him the ability to broadcast it to a wider audience potentially. So, but on that note,
the FOI law requires that this stuff has to be released to the public unless there is a statute that says it cannot be. And there is no statute that says it cannot be. Therefore, the judge should be saying, here are the reasons why I'm refusing it. Mm-hmm. But what the problem is that the judge now thinks he's the king, and he doesn't have to actually answer the questions that the FOI law requires him to. All
right. Well, we will leave the very capable attorney to fight those battles, and to certainly, I'm sure you guys will keep us updated. I know he indicated that he wanted to appeal the decision to the Privy Council. So,
well, no, what we're talking about here is a simple FOI request for a document that was made public, and the judge is acting as if this is nuclear secrets or something.
Mm-hmm. All right.
Which is ridiculous.
Keep us updated.
And we're talking about Bernie Bush. This judge had much bigger problems than that, because that kind of attitude, you're telling me it's affecting you, the attitudes of judges, and that you're fighting to get a simple document. That kind of stuff shouldn't be happening. The judiciary is not here to be our God.
All right, we do have Mr. Blika on the line, so just hold on a second. I'll put the two of you on. And good morning, caller. Welcome to the program. Hello?
Hello.
Yes, morning.
Sandra, how are you?
Not bad, thanks.
You've got into a you've got into a tussle with Mr. Warren.
Yes, not the intended conversation this morning, but there you have it.
Yeah, yes. Well, yeah, I mean, it's always good when I see you engaged, because you bring the best out of each other. Let me come in and say something about this, because this is something, as you know, I don't need to explain it to the two of you. It's very, very important. It relates to freedom of information. It relates to fundamental rights. It's right now we are discussing it around my case, but this is one. It's great that, Sandra, you've also brought out the practice direction, and in your own case about the reason you have to give. First of all, you don't have to give a reason to a judge why you want a transcript of the proceedings in which you were involved. Why do you need the permission of the judge to do that? As Mr. Warren has pointed out, under Section 7 of the Constitution, you have a right to a public hearing. Now, they are saying that public hearing right, it means you can sit in the court, but it does not mean that you can get a recording of the proceeding. That's ridiculous, because Section 7, once it gives you a right to a public hearing, by implication, an extension of that right is to be able, especially if you are a party, to get a transcript of what your eyes and ears observed in court. Because a lot of times you want to use it to advance your own case in some other matter, or for your own record, and you should be able to do that. Okay, now, let me go back to FOI, just to expand on what Mr. Warren has said. You see, the FOI law, and by the way, I was involved in writing the FOI law. I was the drafter involved in writing the FOI law back in about 2008, thereabouts, working with Mr. Tibbet. It was Mr. Tibbet's, sorry to digress, it was Mr. Tibbet's pet project when he came out of the opposition, came into government. I want this. So I've got an understanding of some of the thinking that went behind it. The idea of FOI was that all public records must be made available to the public. That's the legislative scheme. Now, what the law said was, however, there's no need to disclose, or rather, a government can refuse to disclose certain matters that are exempt. Matters relating to the deliberative process of cabinet, security, and a whole range of things in Part 3 of the law. That is one. And then secondly, the provision that Mr. Warren has pointed out, he didn't cite the section, but he cited the idea. It is Section 3.7 of the FOI law. Nothing in this act shall be read as abrogating the provisions of any other law that restricts access to records. So, in other words, having started from a premise that all records must be released, they can be exempted, however, from release under Part 3, or they can be exempted if there is some other specific law on a specific subject matter. And it's not just a law, it's a statute. It has to be an act of parliament because it's an uppercase L. Okay? And then you can say, okay, it can't be released. So in other words, if they had a statute, say, like the Judicature Act, Grand Court Act, Summary Court Act, which says that proceedings that take place in a court of law, they may not be released. Okay? Then you can, then the judiciary would say to you, you know what? Under Section 3.7 of the law, it says that if there is a specific law, that law can create an exception to FOI, and therefore we are citing section whatever of the Judicature Act, which says that we are entitled not to release these records. That law doesn't exist. I wrote a letter to the President of the Court of Appeal. I say, you tell me which law was enacted under Section 3.7. You tell me which law says that you can withhold those records. Don't cite for me the practice direction. The practice direction is not an act of parliament. And he has refused to cite that law. That is lawlessness. And he has refused to actually, not to just cite the law, but he has just said, I don't have to answer it. And I told him in the letter, I said, you know what? For a court of appeal, I expected more. I've cited the law to you, the sections, I've reasoned it, about 4 pages. And you send me 4 lines to say, basically, I don't have to answer it. And that is lawlessness. It is a violation of the law, and people should be entitled to those records. And like Mr. Warren has said, this was something I specifically requested, a live stream. He gave an order that the thing should be live streamed. It was live streamed, although they tried to play a trick with me. They put it in courtroom 8 physically, but they put it in courtroom 6 on the website, so that those who went to the website, some of them missed it, but we had a network where we've sent a message to people so that they could go to courtroom 6. So it was live streamed by specific order of the court, and people could have, if they wanted, they could have recorded it illegally. And just let me end on this point. They did record it, but when I requested it, they gave me an audio. Okay, so that they did record it. The interesting thing about that is that for them to give me the audio, they have to go to the video recording, do some work to remove the video or separate the video from the audio so that they can send me the audio. So they have gone out of their way to try and give me less than was broadcast. There can be no foundation in law about that. I'm challenging it. I think ultimately it will wind up with the ombudsman, and then I hope that we can get a ruling which will make it easier for CMR, for Billy Simamba, for Danny Warren, for anybody out there who wants their record to be able to get it easy. Let us try and create precedent.
So, and just to bring people up to speed with where your matters are. So you had your hearing, was it last week or the week before? It was the week before, I believe. Your Court of Appeal. Right. And you did lose, you actually lost that hearing. So you're now looking to try to appeal to the higher court, which would then be the Privy Council.
Yes, that is correct. What they did on the 31st, I lost the appeal in the sense that, well, what they did was as soon as the hearing ended, they gave an indication that I had lost all my 3 elements of the appeal. One, I had asked them to recuse themselves because I said, how do you decide a case? You are judges who are long-term contracted to the judiciary in Cayman. How can you be objective in deciding a case which involves the suing of a judge? They refused to recuse themselves, which was very interesting because under the code of conduct, it says that normally you should recuse yourself in such matters. And then 2, they struck out my matter in the Grand Court. They didn't even hear the evidence. They struck it out. And I appealed against that. They said, no, it was correct to strike it out. By the way, striking out, as people must understand, you understand that, Sandra. Striking out means that when you come to court, they think that your case is so hopeless that there is no need for it to even go to a hearing, that you are even abusing the process of the court by even bringing it. That's how bad a case has to be struck out. And yet, in my particular case, when I first brought the matter, the Attorney General and the Governor filed a document to say they were very concerned about what this judge was doing. They wanted there to be a hearing in the Grand Court. There should be a cross-examination. I have a letter from the Governor, as well as a formal filing in court where the Attorney General and the Governor said we're concerned about the behavior of this judge. We want it to go to the Grand Court so that it is heard. Cross-examination documents are produced. And yet when I brought it to the Grand Court, they said, no, it is so frivolous and vexatious. Just strike it out. There's no need to hear it. Okay, so that was the second one. Then thirdly, they restrained me from being able to bring any other action without the special approval of the judge. That order was for 2 years, and the lawyer indicated that actually they wanted it to be extended. So I don't know what the court is going to do. So they told me on the day, everything is dismissed, but we'll give our reasons later. So I've indicated to them that I will appeal to the Privy Council. I've already prepared my grounds, but there's a few other documents which have to be done. So as soon as I receive their judgment and order, I'll appeal it to the Privy Council. So that's where we are with the case. I believe that we should, in Cayman, work towards making judges accountable, because if a person who had evidence to prove my case, 12 emails and all kinds of documents to show that a judge did not tell the truth when they said something, and if I can't get a remedy, and this was my last stand, then it means in what cases are you going to hold judges accountable? I have complained about this judge to the Anti-Corruption Commission, to the police. I wanted to file charges against him, to the Human Rights Commission, to the Judicial and Legal Services Commission, to the Governor. All these institutions, despite the evidence, they have said there's nothing here. I think there's a problem there. It means, therefore, I've got nowhere to go. But the Privy Council will be the next step, and we'll see what's going to happen about that. And lastly, I don't know if you've checked this, Sandy, and I know you're very busy. Under Section 29 of the Grand Court Act, it says that a judge is not protected if he acts in bad faith, whether or not he acts in his jurisdiction. He is not protected if he acts in bad faith. It's in black and white. The courts have said, no, it doesn't say what it is saying. So that's part of the thing that I'm appealing. So it is a lot of things hang on this, and I hope that we can effect some reform in Cayman so that, one, all legal proceedings must be verbatim recorded. Cayman can afford it. People must have a right to get access to them. Before I let go, you've given me so much time. The way FOI applies to the judiciary is as follows. It is accepted as a matter of principle that if something relates to the judicial functions of a judge, you cannot ask for the report of the judicial function. So, in other words, if they have got tapes of their deliberations, you can't ask for them. If they've got some draft judgments, previous judgments, you can't ask for them, because that relates to, the details of their research and so on. You can't ask for them. But if it is a matter which is administrative, it is in the judiciary, but it is administrative, then it should be released. And they accept the principle. Their only problem is that they construe judicial to be very, very wide. Okay? So what I've told them is, look, you are exercising your judicial functions when you decide cases. However, the Chief Justice, at the beginning of the opening of the sessions, always says, here are the civil cases which were filed. There were 200. The criminal cases were 200. They were decided in this way. There's one or two which have not been decided. That has to do with your judicial function, but it is an administrative side of the judicial function, and therefore you should be able to release that. So this recording was an exercise. It was recorded by administrative staff in exercise of their administrative functions, and therefore it has to do with the administration of justice. There is no way in which the courts will perform their functions better because you don't get your video. Okay, because the exception is meant to be functional. It is supposed to ensure that they exercise their functions freely and without being open to judgment. It is the same reason, for example, in government, you can't release the deliberative processes of cabinet, what people said in cabinet or not, but you can release what the decisions were. It's the same thing here. So how can they, and the reason you do that in cabinet is you want to make sure that people can express their views very, very freely. A civil servant can express their views freely. That's why you don't want to release that part of it. But how does that relate to the functions of the judiciary? If they give you a video recording, how does that impair their exercise of their judicial function? Let me end there, but those are the issues we want to litigate.
Well, I'm sure that you'll keep us updated on what sort of progress you make in terms of all of these questions and actually accessing that recording.
Yes, we'll be able to do that because I think it's of great public importance.
Yeah, thank you. I appreciate it.
Thanks very much. Take care.
All right, folks. 936-2626 is the number to call in. So, Mr. Baliki continues his fight. I feel like I'm mispronouncing his written name, but you guys know who I mean. He continues his fight to get these Balika Samamba. I think the second name is much easier to pronounce. But he continues his fight to get what he says is justice. He did lose this round at the level of the Court of Appeal. And so, it is quite a big deal to go up against the Court of Appeal. In fact, we are monitoring a few other cases. The Court of Appeal does have an active hearing sitting at the moment, and we are monitoring a few cases, including the one with the land situation there in West Bay as well. So the Crown didn't quite show up as prepared as they could have been because the judges were asking for documentation and proof of what had been provided to the other party. And for some reason, the Crown, my apologies, appears to have showed up to court without those documents. Slackness. But in any event, these are the things that, and the odd thing is, for some reason, that recording, that particular live stream, it didn't look like they had a live stream for that particular hearing. I'm of the opinion, I want to be very, very clear about this. I'm of the opinion that any and all court proceedings, even what's happening in summary court starting at 10 o'clock this morning, I think all of that should be live streamed. Anybody, anywhere in the world should be able to sit down and view those proceedings in the interest of making sure that justice is open and transparent. We operate under the English system, and unfortunately, the English system in this regard is nothing like the American system, because in the American system now, most courtrooms have a camera, and most courtrooms have the ability for that to be live streamed out. And I don't know what the thinking is as to why that isn't done, but it looks like it's one of those things that we'll have to probably take some sort of legislative change to occur, as opposed to the judiciary being mindful to do it themselves. So it's only since COVID times that we've had freer access to links, and it has continued up to a certain extent, where if there's like a sentencing hearing or whatever, they will normally provide it to media. And, the general public, I suppose, can dig about on the website and try to find it, but it's for the most part not distributed to the general public. And that's unfortunate, because I think it should be. I think anybody should be able to sit down and watch a court of appeal hearing, summary court, grand court, whatever, so that you can watch these trials as they occur. So I do want to rein the conversation back in just a little bit so that we can get back on topic. One of the things that we have on the agenda this morning that I think is super important, I tell you what, we need to talk about Cayman culture and heritage, but that's going to be pushed back another day. Hopefully tomorrow we can get to that conversation. But you guys remember that yesterday morning, we talked about this briefly in our news segment. We talked about this assault that took place in Prospect. And a lot of questions, I was asking questions from the onset because there was something that didn't really feel quite good or right. Not good. Good isn't the right word. Something was off with the information that the RCIPS had provided us, which is information that we then used to be able to inform you all. I mean, if the RCIPS says this is how it happened, this is what happened, we have to go by that unless we know differently. So I had a lot of questions. I reached out to MP Turner. She hadn't heard anything about the assault at all. And so what the RCIPS had said is that in the commission of an attempted robbery, that this woman basically was attacked in the district of Prospect. Well, I think that maybe that isn't actually correct based on additional information that we have been able to ascertain. I'm just having a look here. Yeah, because they do say that a man approached she was approached by an unknown man who appeared or who opened her car door and attempted to rob her. And so that's where we got this attempted robbery as being the underlying reason for why she was attacked. Well, my sources say that that's not what this was about at all. That in fact, what this looks like, and I think this is where the community needs to really know what's going on, as this was an actual attempt of a sexual assault. In other words, this man was trying to rape her, not rob her. And they are two very different things, folks. And, as a woman in this community, you could understand why you would be extremely concerned about a rapist on the loose or a potential rapist on the loose in your community, as opposed to someone who's maybe trying to rob you of your goods. So, the story doesn't quite match with what our sources have shared. So this woman was bruised and battered quite seriously, to the point where people who are very familiar with her, and we do know who she is, but obviously we'd never disclose that information. But those who are close to the situation have actually said that, people showed up at the time of the assault. The ambulance had to go for her. So there were witnesses there shortly after who some say they were impeding the investigation a little bit. Like people like, you do realize this is a crime scene, and just be cautious and mindful of that when you drive up or you go to someone's driveway to see what's going on with them, that you don't want to tamper with anything that could help the police in trying to apprehend this individual. But the truth of the matter is she was assaulted physically. Someone made the analogy that she looked like she'd been in a UFC fight. And they're like, this was not a robbery. This man was actually trying to get her in a position where he could sexually assault her. And she decided to really fight. And he repeatedly punched her multiple times in the face. And she was all bloodied and bruised. And, it looks like what he was trying to do was to knock her unconscious. You don't have to knock somebody unconscious to rob them. Like if you wanted that handbag, you push somebody, you shove someone, maybe you punch them once to get them to let go of the handbag or whatever it is that you're trying to grab in a robbery, and you take off. This type of assault, if you know anything about criminology and how criminals act, this is a type of assault where he was purposely hitting her in the face, making her all bloody and blood pouring everything, and beating the crap out of her in order to render her unconscious so that he could carry out some sort of sexual assault. And that's what people think was really going on here. So they were a bit put off by the fact that the police have maybe prematurely concluded what they say erroneously, that this was a robbery attempt, because in their opinion, this was not a robbery attempt at all. Thank God, obviously, the fact that she decided to fight, and this person did not have their way with her. So we just wanted to put that information out there because, again, if it's the case that we have a rapist on the loose, this is something that everyone in this community, especially the women in this community, should be very, very mindful of. In fact, you guys might have heard of a recent case in the US. I was reading this last week where a woman was abducted, and no indications if she was sexually assaulted, but she was abducted and later killed by her abductor. And he was a man who had been in jail for some 20 years for kidnapping somebody else years before. And there's a whole movement now because she'd got up early in the morning, like 4:30, 5 o'clock, and gone jogging by herself, a wife, a mother of two. She's actually the heir to some fortune. I can't remember what her family is connected to. But, this story, I believe it was Michigan, but this story really took on, a life of its own, because men are saying, hey, as a man, I can get up, I can go jogging at 2:30 in the morning, 2 o'clock in the morning, whatever I feel like it. But women don't have that luxury. Women are constantly, being questioned about what are you doing out at a certain time by yourself, or why are you wearing this or that, and all these types of things. And it has really forged the conversation about the safety of women in more than one way, really. And this community is certainly no different. Why is it that women cannot be safe to pull into their driveway without someone trying to attack them and sexually assault them? So these are ongoing conversations. For many, many years, women in this community have been requesting some form of personal protection. Can we get something, whether it's mace or pepper spray or whatever? What steps can women take to try to protect themselves more? And unfortunately, the judiciary, and I suppose not the judiciary, but the legislators and the powers that be have not seen it fit to really give women any of those protective elements. So we are left to, we're left to the wolves out there who are seeking to prey on women, that they see as easy victims. And so it is really, really unfortunate. Even as I read that case about the lady who went, running, and then who was kidnapped and eventually found killed, it was quite an unfortunate turn of events and quite an unfortunate situation. Her name is Eliza Fletcher, and this has been carried by all of the news, all over the U.S. But a lot of people now expressing, concern over this, and they feel like there are things, this guy, by the way, got early release by a couple years. So technically, I think he might have still been in jail had they not released him early. After 20 years, they probably thought, oh, maybe he's learned a lesson after being in jail for 20 years, but clearly that didn't work out too well. So they did have some evidence that, she was abducted pretty early on. I think they had some CCTV footage and so on. Knowing what type of vehicle it was, they were able to narrow the field a bit and eventually found her body some days later. But looks like she never even had a fighting chance. So she was a 34-year-old school teacher. She went out jogging, and again, a man approached her and forced her into his SUV, and her body was found some days later. Really, really sad. And this man, Cleotha Abston, only 38 years old, has now been arrested. Imagine being 38 and already spending 20 years of your life in jail for previous kidnapping. So this guy is obviously, a lifetime criminal. He doesn't know anything else, I suppose, at the end of the day. So very, very unfortunate. But, here in the Cayman Islands, I think when things happened, we had the other young lady, remember the other jogger earlier in the summer who was attacked by a man. A lot of questions are coming out of where that story is at. And what we found here is the police in particular seem to tell victims, oh, don't talk to the media, don't share your stories. They do it under the guise or the explanation that it could potentially somehow impede the investigation. But what we find is really the real reason is that they don't want people in this community to start standing up and protesting this sort of thing. You leave them to their own devices, and the case either gets dropped because they say, oh, the victim isn't the most reliable eyewitness or whatever. And then nothing comes of it in terms of justice. So even the young lady who we did an interview with, she wanted to go on camera, talk about what happened to her as she was out jogging that morning, warning women. She was bruised and battered at the time that she did that interview. And she also said, listen, I went out jogging, minding my own business. It wasn't really that late in the morning because it was like after 7, 8 o'clock or whatever in the morning. And here's a guy on a bicycle who went off into the bushes and decided to grab her and throw her down on the ground. And once again, his intent, it looks like, was to sexually assault her. And, she fought and she screamed, and that kind of scared him off. And he ended up running off as a result. So we don't know if that young lady will actually get any justice, but we will continue to monitor that situation. I think that she recently had reached out by way of someone else to us to essentially say that she was not really impressed with how the police were handling the situation. So we'll try to see if we can get any kind of updates, from her. But really, really sad when we have to question even the competence of the people who then will be working on these cases. So, yeah, it's unfortunate, but you've got to be super careful out there. All right, so Ace is joining the program this morning. Thank you so much, Miss Iseline. Good to see you. Good morning, Miss Sue. Marshall says it was a very sad case with that school teacher. I'm glad that they got him. Well, hopefully, there will be some justice in that regard. But, now she's left behind a husband and 2 young children. And of course, a slew of other people who, will miss her dearly. And as Ms. Sue says, really sad because now who's going to be the mother for her children? Gabby, good morning, says they're not going to take these things seriously until it starts happening here. Well, as I just said, we already have at least that case and a few others I'm aware of where it has happened here. Women have been abducted and killed in this community. We don't need to go too far to remember the case of Estella Scott Roberts, who was brutally abducted and killed a number of years ago. And what has changed as a result of that case? Are women feeling any more secure in this community? I would say absolutely not. In fact, most of us feel like the burden is placed completely on us as potential victims. We're the ones who have to travel in groups. We're the ones who have to, call each other as you get in your car to make sure that you're safe and to make sure that you've arrived safely at a location. There seems to be very little that is being done by the authorities. So someone said, this is back in August, they said, in relation to the woman who's attacked in South Sound, they said regarding this rapist, basically they're trying to drop the case and make him walk free. This is sentiments coming out of how the victim is feeling. And, they've canceled the trial date now 4 times, and she really needs some exposure. And how the RCIPS are treating her since she went public on CMR, absolutely disgusting. And this is very, very unfortunate. And they're even saying that they bet his ankle bracelet is now off. So, wow, if that's exactly how this situation is being handled. So we do want to, again, remind people that when you come up on a situation like this, a lot of times it is an active crime scene. And so you have to be mindful of that because there's the real potential for you to contaminate the crime scene. And, you have to understand that there's also people on the location, at the location, I should say, who are trying to render immediate assistance. And in this case, a few of the people made the observation that some of the onlookers who were there as eyewitnesses might have been interfering even with her ability to get immediate and proper medical care. So, yes. So Gabby reminds us that there are people who've gone missing without a trace for years now and nothing is being done. Well, I wouldn't say that nothing's being done, but the police are not capable of solving those crimes for whatever reason. Normally the reason is they need members of the public to come forward. And, sometimes members of the public don't come forward because they don't trust the police. And other times they don't come forward because they simply don't have any information. I mean, you kind of feel like there's always someone out there who knows something. And so you should speak up. But, we see a member of the public has come forward in another case, and she was allegedly threatened by a police officer not to become an eyewitness in that case. And, to this day, the police have not named who that officer is. He is on suspension, getting full pay as that investigation continues. And I think we're waiting on a verdict on the primary case, and then I guess we'll see what happens to the police officer as the public continues to pay him. So there you have it. But yes, we do have Anna that's missing, but I believe that in Anna's case, she's presumed dead. It looks like it was probably an unfortunate accident at the dump that took Anna's life. And, the cadaver dogs, I think, provided some assistance in them concluding that she never left the dump, that's for sure. And maybe some sort of heavy equipment probably just crushed her. And that was the end of it. And of course, Carrie Ann, can't remember Carrie Ann's last name now, that has been missing for years as well. Ms. Sue is asking about missing the governor. You can hit the rewind button, but basically it will be the premier and his wife and the governor and his wife, and then some of the delegation in the UK from the UK office that will be going to the official funeral and perhaps also have an opportunity to see the Queen laying at Windsor. I think it's at Windsor is where she's going to be. And someone else says another Tuesday and no answers on the child who died in Cayman Brac. So that's another case that once again, we're beginning to wonder if we'll ever get an answer, if we ever hear anything further. Nothing more. We'll send another email to the RCIPS, but I wouldn't expect to hear anything different other than they're still investigating. And this seems like quite an investigation. You would think at some point there'd be some sort of a conclusion to this. Someone also mentioned that the Odie, who's the victim in that South Sound assault, attempted assault, is running 4 marathons to raise money and awareness for these types of assaults. And she just did her first one and she did great. So congratulations to her. We'll catch up with her and have a chat with her to see how she's doing and how things are going. But, very, very scary situation to be in the shoes of these women. We're glad that at least in Odie's case that she survived it, and even the woman from this weekend that she survived it. But let me be very, very clear that you're never the same again after a situation like that. I'm sure of that. Someone else asking about the investigation into the death of the canine. Again, no new updates. So nothing there. And also we have other concerns about, the other concerns about other things that have gone under the radar, including the fact that, we just don't have answers about a lot of pending things at the moment. Even Miss Cayman Committee, still nothing from them. No statement. We know the governor, not the governor, but the minister is busy this week with the CTO visitors on island, but still nothing by way of an update. The committee claimed that they were carrying out an investigation into the facts, as they said. And, we have yet to heard what their investigation has involved and what conclusions that they've made. So it seems like, these issues are brought up, and what ends up happening is they just continue to be on the back burner, perhaps with the hopes that we will all forget about it, and move on. And that's it. Very, very sad if that's the case, because we don't forget. And we're oftentimes very, very, concerned about what's happening in our community, and we don't get any answers. So Ms. Sue says, sounds like people not happy with Bernie Bush. So yes, we've discussed that already, Ms. Sue. So if you hit that rewind button, you'll catch that portion of the conversation. So the official funeral is on Monday, the 19th. It is a public holiday. And I'm a little bit confused because I've got people asking me, does that mean that businesses are going to be closed? Well, it's like any other public holiday. They're like, is the bank going to be closed? It is a public holiday. So yes, certain essential services like grocery stores, they decide which holidays they close completely. So I do know, for example, that the Foster's Group intends to be open with their holiday hours, which, as I recall, is 9 to 6. So they do close, yes, their holiday hours 9 to 6. The only day I think the Foster's close completely is it Boxing Day and New Year's Day? There's 2 times a year that they are completely closed for holidays. And then otherwise they have holiday hours, which are significantly reduced. So I think Cost You Less is going to do like 8 to 6. Hurley's will be closed completely. I don't know what Kirk Supermarket is doing. And then there are other businesses. I don't know if you guys saw this or not, but Blackbeard's Liquor, they said, listen, although they're in the retail space, they were not going to open up, or they're not planning on opening up on the 19th. They're going to observe the holiday. This is what they said. As a mark of respect to her late Majesty Queen Elizabeth II, all of our stores will be closed on Monday, the 19th of September, the day of her state funeral. So individual retailers are taking their own position on that, but everybody else, like the usual banks and whatever, should be closed. So someone clarified that Christmas Day and Good Friday are the 2 days that Foster's does close completely. So yeah, there you have it. So yeah. Mm-hmm. Mm-hmm. All right, folks. So that's what we've got for you in terms of that. I don't know what else to tell you about the public holiday. The schools are obviously going to be closed. Most people, I would say, are closed on that day. Mm-hmm. Okay. So there you have it. So someone says, so startling that the police can arrest men in Cayman that are wanted in Jamaica, but can't find wanted men in Cayman. Well, these things are never easy for the RCIPS. And I think part of the reason is that there is an element of criminality where people are hiding information. They don't assist the police probably as much as they can. And so, even the men that they found here from overseas, a lot of it was quite accidental in how they found them. And, yeah. Yep. So there you have it. Yeah, that's what we got. Let me just check. All right. So let's speak briefly about this donkey situation. I know a lot of people think this is a bit of a funny story, I suppose, that these Nigerian donkeys are being exported. Well, not the donkeys themselves. They actually kill the donkeys to get their private parts and then sent to China and Hong Kong and stuff like this. Yesterday, as I was at the CTO conference at the Ritz, and I was listening to a lot of these other countries and jurisdictions in the region talk about the things that they're doing. Everybody's trying to do different things, but I mean, there are limitations to what you can do to attract tourists. So there's only so many types of experiences that you can have and so many levels of uniqueness before the American visitor or the Canadian visitor goes, the Caribbean sounds like all the same to me. But everyone is trying to do things that make themselves stand out a little bit more. So you know how in the Bahamas, they had the whole swimming with the pigs situation. And then after that massive storm that they had a couple years ago, I think the pigs, I don't know if the pigs got killed or washed away by the storm or displaced or what happened, but that kind of like disappeared. And the pigs are now gone. And, you don't just bring pigs in, like adult pigs, and be like, okay, just swim with people and play nice and be nice. Like most pigs are going to be like, what? No, like you have to kind of raise them from a certain age and, whatever. So it looks like they've abandoned a little bit the swim with the pig situation. And now they were talking about yesterday at the conference that they have swim with the goats. And I remember sitting there going, swimming with goats? Like, are goats good swimmers? Like, I don't know anything about goats wanting to really swim. But apparently they've been spending some time with these goats, teaching them to like the water, I guess. Or do goats like salt water? Like, I don't even know this is a thing. But anyway, they have an experience that they're trying to get tourists into. Swim with the goats. I thought, okay. Everybody's trying to do something different. Everybody's trying to stand out. Some of these jurisdictions are building cruise ports. I think the Bahamas mentioned like 3 different cruise ports that they're going to allow to be built on a number of their different islands. Obviously, they have more islands. Was it them or TCI? I have to go back to my notes. Maybe it was TCI that was doing the 3 ports, but a few of them are doing cruise port facilities. A few are revamping or, rebuilding or getting new airports. And so there's a lot of infrastructure improvements that are happening. I think some of these smaller jurisdictions would even put our airport to shame in terms of the size and sophistication. Someone told me some of them have elevators and escalators and all sorts of stuff that here we are, supposed to be the richer Caribbean country that we don't even have at our disposal. But nonetheless, everyone is fighting for a piece of that tourism pie. And, the benefit of the CTO is you get to hear from other jurisdictions. And you also hear how a lot of them are very, very appreciative of how, in some respects, it is a collaborative effort to attract people to the region. And then obviously people will have different things specifically about why they might want to go to one country versus another. And there was a lady from Grenada who I really, really enjoyed her presentation. In fact, afterwards, I had to go up to her and give her one of my business cards because I was like, oh my God, this woman, I'm very, very impressed with her. Her presentation was off the chain good. It was engaging in the works. She's originally from Barbados, but, she talked about we're not for everyone. We have, 2,500 available beds in terms of for the tourist market. And so they're encouraging the Airbnb market. They're encouraging people to stay with locals and have more of a local experience. And there was a few other jurisdictions that talked about that as well. Like they do a host program where you get to attach yourself to local family when you vacation and see what life is like, living with a Caymanian sort of thing while you're on your vacation. So it was super, super interesting. I thought a lot of them were informative and quite good. They did a lot of like video presentations and stuff. And so the conference continues until Friday, and I'll do a more comprehensive dissection, I guess, of the whole thing once it's over. But for the portions that I was able to attend yesterday, I must tell you that so far it is very, very engaging. I think most of today, from what I understand, will be the ministers and others, high-level tourism officials, sort of meeting behind closed doors and talking about strategy across the region and so forth. So that will not be open to the media. There's only certain events that we can attend. But again, this is the Caribbean Tourism Organization conference, which is being hosted in the Cayman Islands this week. And I thought it was really quite nice of the minister to invite the visiting ministers to attend Parliament yesterday and to actually experience that, to be able to sit in Cayman's House of Parliament and see, the tributes to the Queen and so forth. And this is why I thought to myself, given that it was being televised to, I'm sure thousands of people go back and watch it, and that we also had visiting guests, I did think it was really, really interesting to see how Mr. Bernie Bush conducted himself. Someone else says, good morning, Miss Sandy. I only managed to hear bits and pieces of the morning show as I was in meetings. What exactly is it that Bernie Bush is being criticized for? I must admit, I'm not sure. So unlike everybody else, and I mean everybody else who participated yesterday and who, gave their remarks, this was a special sitting in honor of the passage of the late Queen Elizabeth II. His contribution was less than stellar. I'll find the video clip and I'll actually post it up a little bit later on. I'll go back because literally he stood up and said, may she rest in peace and God save the king, and sat down. I mean, literally that was it. Like I'm not exaggerating in any way. If it was 30 seconds, it was plenty. And so I left going, huh? What's the point even? Like, why were you there? He has, I think, probably made no secret of the fact that he's not a fan of the British, although we are British overseas territory. And he has some very, very strong feelings about people of British descent. And so that being the case, I'm not so sure that he's representing. My only question is he representing the views of his constituents? I mean, you guys who live in, I can't remember what district he's in, West Bay North, I think. Are you satisfied with that response? Have you been satisfied with his performance even since he's been in office? I have said, and again, I'm sure Mr. Bush is not going to like this, but I have questioned whether or not he's done with politics to the point where he's not really giving much of an effort. And this was even before he was stripped of his one aspect of his responsibilities as minister. I kind of feel like he's checked out, so yeah, it is what it is. All right, folks. So thank you as always for tuning into the program. Ms. Brenda says all we had to offer is now gone. So sad. People are looking for uniqueness, beaches and natives, and it's all gone. Well, like we say, if you don't have anything to say, just stay silent. And so I thought it was one of those things where perhaps he should not have even bothered going. What's the point of sitting there for hours listening to other people speak when you feel that perturbed about the British? I would have just not shown up at all and done something more productive on behalf of my constituents. So someone says, do we have a new holiday with the King's birthday? I'm sure that we lose the one from the Queen's birthday, and yes, the date will probably change, but it's not like you're going to get an extra one. So Marshall says Jamaican criminals aren't hiding in Cayman; they hide in their own country. Cayman criminals are hiding in Cayman, and people are helping to keep them hidden. All right. So thanks, folks, for tuning in. Tune in tomorrow morning. Hopefully tomorrow, I think we do have home guest that's going to be joining us, but we'll have lots of time to discuss our cultural adventures that we went on over the weekend. So please, folks, do tune in for that show. And until then, have a fabulous day.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels and visit CaymanMarlRoad.com for all the latest news and community happenings.